Good morning. It is 10 o'clock still. We're calling this workshop to order for LifeStream and our mental health system. At this time, if you would like to, if you're able to, please rise. We're going to have the invocation and the Pledge of Allegiance. Would you mind leading us in the Pledge of Allegiance? Thank you. Dear Heavenly Father, thank you for today and thank you for all your blessings. Pray that you forgive us of our trespasses and that we forgive those that trespass against us. I ask for wisdom, Lord, and that you can help us open our mind and solve this problem that we have before us and listen, and that we all gleaned from this workshop today wisdom beyond measure. Thank you for all that you do for us. Thank you for our military and our first responders, and pray that you put a hedge of protection around them. In your name, amen. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Howard, do you know if Commissioner Davis is coming to this? Okay, at this time, I would ask Amy, our clerk, to roll call, please. Give us roll call.
This is a public workshop of the Citrus County Board of County Commissioners, the 14th day of March, 2023. In attendance are Chair Ruthie Schleybaugh, Second Vice Chair Rebecca Bays, Commissioner Jeff Kennard and Diana Finnegan, County Administrator Steve Howard, and County Attorney Denise A. Diamond Lynn.
Thank you. Okay, item B is the presentation, and I would ask that Mr. John Cherry from LifeStream, will you be presenting by yourself or?
No, ma'am. There will be at least two of us
Okay,
presenting.
I see Rick Hankey and Carol Dozier.
Rick Hankey will be presenting also.
Okay, and I see Susan Lake.
Yes, ma'am.
Thank you, sir.
Thank you. Thank you, Madam Chair, Commissioners, for allowing us to come present to you this morning. As you know, we've been providing behavioral health services in Citrus County for the last 4 years or so. We want to talk to you this morning about where we've been, where we are, and where we hope to go, and specifically talk about the potential of building an inpatient facility, which would be a Baker Act receiving facility. We have presented to the board twice before. The first 2 years that we were here, we were asked to come to your convening of, I think, all the governmental officials in January. So we presented those first 2 years at that forum, all of the information for that previous year and where we were at the time. COVID hit, and I assume that the meeting got canceled, and we haven't been invited back since then. So this is our first opportunity, and we thank you for that. We do have Rick Hankey, our Executive Vice President, with us today. Rick is responsible for the continuum of services in Citrus County. We have Susan Lake, our Clinical Director for LifeStream, with us, and we have Carol Dozier, our Chief Financial Officer, with us. And we know there are going to be a lot of questions. I don't know if you want to ask those during the presentation or let us do the presentation and then ask, whichever.
Would it be okay, if not that disruptive, if we could at that point ask? And I do appreciate you coming for this workshop because Commissioner Davis and I were elected during COVID, and we have Commissioner Finnegan and Commissioner Bays who are new this year. So I thought it would be a perfect opportunity for you to come and speak to all of us. It's a new board and a new day. So.
Exactly, and we're glad to come back anytime that you would like us to also.
Thank you.
So,
and Amy, you saw Commissioner Davis. Thank you.
Madam Chair, my apologies for being late, and thank you for not saying you're appreciative of me showing up too. You missed an opportunity there.
No. Okay, thank you, Mr. Cherry. So we'll ask as you go.
All right, that's great. That's great. So I'm going to call on Rick Hankey to start the presentation, and he will go through about half of the presentation, and then I'll come up for the final items that are on the presentation. So, great. Thank you.
Good morning. The last time that I actually presented, it was a totally different group of people except for Commissioner Kennard. So my name is Rick Hankey. I have the honor of serving as the Executive Vice President for LifeStream Behavioral Center. And when we first came into Citrus County, I was blessed enough to be the architect of the services that we brought in. So I'm going to tell you a little bit about that because I think it's important to understand the genesis, or how we started and where we are today. So, and please ask any questions as you go in. It won't set anything off or anything like that. So, kind of going back in history, when we first came into the county, there really wasn't what was called a system of care. And so as we looked at what are the services that are needed, we took the community mental health model and said, well, there should be a continuum of care. And what I mean by that is people with mental illness and substance misuse often are all over the place with regard to the need for services or the acuity of their issues. So we wanted to make sure that we were able to address some of the primary or some of the preventative issues all the way to acute care services. However, at that time, there was a limited amount of dollars. We are a community behavioral health center, and we do receive funding from Lutheran Services, our managing entity, to serve the indigent population. We also we work with Medicaid and Medicare, as well as commercial insurances, and that's how we're able to develop a system of care. But it's not something that happens overnight. It's something that takes time to develop, especially here in Citrus County. So when we first came in, first slide, please. When we first came in, the top, as you can see, that was the proposal that we wrote. We wanted to be able to provide these services, and we actually introduced them into the county in different phases. So if I just go through each and every one of them, because I listened to the last meeting in which this was discussed, and there was a lot of confusion as to what we do as a community behavioral health center. We're not just a Baker Act receiving facility, and I want to make that really clear, that we provide the full spectrum of services that one would need if he or she had behavioral health issues. So we're just not that behavioral. That is one of the issues that we will talk about today, but that's not who LifeStream is. Also at that time, the county commission was very strong on whomever came in as the provider had to work with the county in order to develop a Baker Act receiving facility. We said that we would be happy to do that. We have experience doing that, and that's why that's why we're coming in and saying that a Baker Act receiving facility is needed in Citrus County. That was also part of the commission's kind of demands, if you will, as we were going through this negotiating process with Lutheran Services. But I also met with several of the county commissioners to say, what is it that you want here in Citrus County with regard to a mental health or a behavioral health? When I say behavioral health, I'm referring to not only mental health, but substance misuse issues as well. So let me backtrack a little bit. As John said, we've been in business for over 50 years. We are a not-for-profit organization that is also known as a community health provider. We are a safety net. We work with a lot of indigent people. We work with others as well, but there is a lot of our services also work with the indigent population. So we can't refuse people services due to their inability to pay, and that's part of our agreement with Lutheran Services. We also,
Sir,
yes.
could you explain to the public what nonprofit you actually are under? Because there is some confusion about, because you're a not-for-profit, that you don't have generate revenue and have a profit. Could you explain which nonprofit you're under?
Yeah, we're classified as a 501c3.
Right.
And basically it means that if there is any profit, it goes back into services.
Correct. Okay. Thank you.
So going through, I don't want to go through each and every one of them, but I'll highlight the different areas. The system of care that we proposed had, like I said early prevention services all the way to the deep end. We knew that we could not start with the deep end services here in Citrus County because we didn't have that facility. We did have a facility in the Leesburg area that we proposed that we would be able to treat individuals who needed or came to us under the Baker Act. At that time, Baker Act individuals were going up to Marion County and they were going to all the different surrounding counties. Whoever had a Baker Act receiving facility, that's where individuals went. We worked with the county as well as other stakeholders in developing the transportation plan that they would bring individuals. At first, it was going to require law enforcement to bring individuals to our facility in Leesburg. That would take them off the road and protecting our citizens for a long period of time. And we said that's not a very good option. So we came up with an alternative, and that was our access center in Beverly Hills, that if someone was picked up under the Baker Act, law enforcement could bring them to our facility in Beverly Hills, and we would do the assessment there. And then we said that we would then transport them to Leesburg if they needed hospitalization. So that's how that whole piece started. Well, then there was a question, what happens in the hospital system if someone is put under a Baker Act? How do we transport them? Again, we worked with the county and came up with an agreement that we would go to the hospitals and pick them up as well. Now, I will tell you that both systems, there has been confusion, that we've had to go back, revisit. I tell you that in the hospital, often they see mental health different than we see mental health. What is a Baker Act? And we also have to make sure that an individual is what is called medically cleared before we pick them up and bring them to the access center. So if someone, and we have pretty clear criteria as to what that is, but if someone doesn't meet the medical clearance criteria, while we are classified as a psychiatric hospital, we do not have the same equipment as a med-surg hospital. So we have to be very aware of what types of individuals we can bring into our hospital, because we don't have the ability, if someone were to go into a cardiac arrest or whatever the case, we don't have that ability to meet their needs. So we would have to send them to a hospital. So there has been a lot of confusion about what is medical clearance and who is eligible to get services or whatnot. But we do have a small contract with the county that we, after an individual is medically cleared, that we would pick them up and take them to our access center. In the access center, that's where they're going through that first level of review to, one, ensure that they meet the requirements of the Baker Act.
Sir?
Yes.
The Access Center is Leesburg?
Is in Beverly Hills.
Okay,
Yeah.
that is one of my questions. 4 locations, Beverly Hills, Lecanto, do you have one in Crystal River?
Crystal River and Inverness.
Okay.
And I'll go through those locations here in a few moments. So kind of going back to that process, that's why we have the access center, so that we're able to work with individuals. That is not going to stay forever and ever at Beverly Hills. That was a stopgap measure in order to get services to the people here in Citrus County. We all agreed it was not the best way to provide those services, but it allowed individuals in Citrus County who needed acute care to get to a psychiatric hospital. So that's how that whole piece came to life. So when we came in, we said we want to be able to serve adults as well as children. We want to be able to, as I said, that whole continuum of care, and we want to be able to meet the needs. Very similar to a primary care. You know, I wake up with a sore throat, I go see my primary care physician. My primary care physician says, oh, you got a little bit more than a sore throat. I'm going to send you to a specialist. A specialist may do some tests, diagnose me with something a little more serious. I may end up in the hospital. They may do, and I know this is a dramatic example here, but they do their piece of it, and then I may have to step down to a rehabilitation facility of some sort. Very similar in mental health. We have some individuals that may need to just come in, talk to a psychiatrist or provider, get the medication management, And we have others that maybe are diagnosed with schizophrenia and have more severe needs. Maybe they aren't taking their medication. Maybe they haven't been diagnosed before. And those are the ones that may fall under the Baker Act that would then require not all individuals. Those that meet the requirements of the Baker Act would then go through the facility. And one thing that we made a commitment to the county is that we were taking individuals out of the county for the psychiatric hospital piece, but we would wrap them around with services here in Citrus County once they came back to the county. Real important to stress that the Baker Act is up to 72 hours. We have up to 72 hours to work with an individual to determine what the next steps are. At that point, we can ask them, let's say, for example, they are going to be put on a medication and we want to check the side effects. If they are competent, I'm just doing a real simple primer here, but if they are competent, we can ask them to sign in voluntarily. And that would be maybe for a couple of days for them to, for us to see what the side effects of the medication or other things, or if there are some housing issues or whatnot. It's up to the individual who is competent. If a person doesn't meet that criteria, then we can take them to court and we can ask the court to extend their stay with us. And then the third option is to discharge them back into the community. We can't hold people forever and ever against their will, hence the Baker Act. So many individuals will be in our facility for up to 72 hours. We're doing an assessment to discharge them back into the community with what we call wraparound services. So they may be discharged from us with an appointment to see an outpatient provider. We have case management services and other types of things. The goal with our treatment model is not to Baker Act everybody. And I know there's a lot of misinformation going out around the community. I promise you that we are not proposing that we are going to buy a fleet of white vans and drive up and down the streets and kidnap people and bring them in under the Baker Act. That is not the services that we are providing. We actually have that wraparound service, and I'm going to talk about this in a little bit, where we are looking at what are the needs of the individual and what can we provide through either care coordination, case management, or some of our other services that we have here in Citrus County to keep them in the community. Because people with behavioral health issues can be responsible citizens, they can have jobs, they can do the things that anyone else can do. And we want to make sure that we offer them that quality of life. So going back to when we first came in here, with that mentality, we looked at how could we do case management. We have a lot of individuals that are involved in the forensic system, so that's a little different case management than the general population. So we brought in forensic case management. The adult mental health case management, these are case managers that work with individuals that need assistance to get through the system or to get things like benefits, or if they have legal issues, they may not understand how to navigate those systems, and so our case managers actually work alongside with them. Children's case management, very similar type of model. A drop-in center where individuals who have mental health needs could actually come in and spend time with us, and we would provide life skills training and other types of things. We're actually doing those services in our Crystal River location. Family intensive therapy, working with families. Again, our goal is to keep families together, not break them up. And where it's clinically indicated, we work with that family to identify what those needs are to keep that family together. And it could be very simple, like they just don't have electricity, they don't have food, they don't have housing, or it could be more complex. We have a father or a mother who is a substance user, and those issues become a little more complicated. Our adult medical services, where we're actually providing psychotropic medications to individuals. They come in, they see one of our providers. The providers may prescribe medications to keep them stable. We came in, same thing with children. The adult mental health outpatient services, that's a therapist who would meet the traditional therapy. And I know in the last meeting, someone asked about our evidence-based practices. All of our services are using evidence-based practices. We actually go through a process to ensure that we are providing it, that there is fidelity and those types of things. Substance abuse services. We wanted to extend those to adults as well as the children. We have detoxification services. Now, those are in Leesburg. So if someone is in need of medical detoxification services, we do have beds in Leesburg. Two types of beds, if you will. The traditional detox as well as addictions receiving facility, or ARF, for individuals who are brought to us under the Marchman Act. Just to give you a little information, there are not a lot of Marchman facilities in the state of Florida. What a Marchman facility allows us to do, because we are designated as a Marchman facility, it allows us to keep an individual on an involuntary basis. But it also requires us to work with the court systems post-discharge so that we continue to keep that person engaged in treatment services. And we are one of the few in the area. The crisis stabilization services, and those are our CSU beds. They are again in Leesburg. And when we talk about our proposal or our strategic direction with the building, that would include some of these services in the building in Citrus County, because it is our desire to keep these services in Citrus County. And that was the idea all along. As I mentioned, the addiction receiving task, we also have, yes.
On the children's medical services, you're in Citrus County. I have trouble with my child. Bring them to you. Do you have a psychiatric special services or a psychiatrist in person evaluating the child, or is it telehealth?
Right now, it's in telehealth mode.
Okay.
Mm-hmm.
Thank you.
Sure.
Yes,
Ma'am?
ma'am. Yes.
Just to clarify, did you say that when the citrus facility would be built that you would have detox services here also?
Yes. Yes.
Thank you.
And Madam Chair,
Yes.
and would you have a on-site psychiatrist for children?
Yes.
It's built?
That's,
Okay.
yeah, I'm working with a couple of providers right now to have them here in Citrus County. Through COVID, a lot of our services went telehealth, and we're really, now one thing that we have at each one of the facilities here in Citrus County as well as in Lake County is we do have an area set up for telehealth, because we recognize that not all families have internet access or the equipment. So we actually set those up in our office so they can come to the office and get that telehealth service in our offices. And some people prefer telehealth services versus coming in person.
Madam Chair.
Yes, ma'am. Commissioner Bays.
As we, and I know you've done this somewhat, but as we go through each one of these slides, can you tell me what location these services are provided in the county? So if we start back at slide 1,
Okay.
where is that done in Citrus County?
The forensic case management is located in the, it really works out of our Lecanto office at the present. And let me, this is going to get a little confusing because I'm going to tell you where it is right now. We are in the process of renovating. We bought property right in the middle of Lecanto. We're in the process of renovating the outpatient, and our Crystal River offices will move over to the Lecanto. And we also have some shuffling of our other programs. We'll keep our other Lecanto office, but the Crystal River will all move over. So I'm telling you where it is now.
Location? This is
Yes,
the old
yes,
Centers location?
Yes, yes. And right now, finishing up the renovations as well as going through licensure. And one thing that I failed to mention is that we are accredited through the Commission for the Accreditation of Rehabilitation Facilities, and we are licensed by several regulatory bodies. So we have to go through that whole piece before we can actually open up and provide services. So we're in the process of doing that right now.
So it is in operation currently?
Yes, yes, at our other facilities. So I'm telling you where it's at now, but it could change in the next couple of months. So our forensic is, I said, out of the Lecanto. The case management, the next three are Lecanto. The drop-in center is Crystal River. The FIT team works out of our Lecanto office. Adult medical services, children's medical services, adult mental health. The next, continuing all the way to substance use detoxification services are Crystal River. And then on the slide is Leesburg, because those are provided there. The children's task is provided in our Lecanto office. The FACT team, let me tell you a little bit about the FACT team. The FACT team is based out of Leesburg, but the FACT team is dedicated to the 100 most seriously mentally ill individuals. And at this time, LifeStream has the contract for what is called Circuit 5. So that would be Citrus, Hernando, Marion, Lake, and Sumter. So we actually have a team that goes to where these individuals are. And most of these individuals are not living in the community. They're either in a group home or an assisted living facility or something on those lines. And we actually go to them to provide the services where they're located. So while the physical team is located in Leesburg, their physical location, they actually come to Citrus County. The OTPR, that is in Umatilla, and that is a group home for girls that we have available for individuals in Citrus County if they have that need. The peer recovery and support services, they're here, and that is located at our Lecanto office, and then prevention services is located in our Crystal River office.
I think the only one I missed was the children's substance use.
Crystal River.
Thank you.
Crystal River. So that's what we came in. That was the basic roadmap when we came in. Basically we had $500,000 from the county as match and $2.7 million from Lutheran. It was up to us to develop the Medicaid, the Medicare, and the commercial side of the house. I'm sorry, do you have a question?
I do. Back to slide 1.
Mm-hmm.
How many individuals do you have employed in LifeStream who actually physically work in Citrus County daily?
Off the top of my 106?
You have 106 in Citrus County?
No, right now.
No, right now, so take away probably 20. Yep.
So 52 every day are here in Citrus County. Sir, you would have to come to the, yeah.
And Madam Chair?
Yes, ma'am. Continue. You have the floor.
As for those 52 that are here and the 70 that are there, can you tell me about the credentials and the certifications, license of those type individuals to serve our citizens?
Depending on the role, we have, for example, licensed therapists. I believe that we have a licensed social worker and a licensed mental health counselor. The providers that are providing telehealth range from psychiatrists to psychiatric certified nurse practitioners. The case managers, that varies. Some of our case managers have certifications, some don't. Their job does not require that. For the peers, we require all of our peers to go through certification for peer support services. I can tell you that probably half actually have that certification, and the other are in process. It's about an 8-month process for them to go through that piece of it.
And can you give a little more in-depth when you talked about medication management? Do you currently accept anyone into your facility that's on methadone or the three different types of medications? Is that considered part of your medication management or your medication clearance?
Well, kind of two separate topics we're talking here. Our medication management typically refers to individuals who are receiving psychotropic medications for mental health issues. Our medication-assisted treatment, or our MAT treatment, really refers to things like Suboxone, Vivitrol, and methadone. We are not a methadone provider. We don't provide those services. So if someone comes to us in need of methadone, we would make a referral to someone who could provide that service, or we would do an evaluation and assessment to see if Suboxone or Vivitrol would be a better alternative. The all of our providers are certified and trained in order to actually prescribe the Suboxone or Vivitrol. They do not prescribe methadone.
And then more specifically on the medication management, you talked a little bit about if somebody was prescribed medicine. Research tells me that a lot of psychiatric medications really don't start to take effect for 7 to 10 days. If your hold period is 72 hours and you're prescribing psychiatric medications and then they're released, do you release them with medications or are they given a prescription? And if they're on Medicaid and they can't afford that prescription, basically the 72 hours is kind of lost if they're not given medication to take home or can't fill the prescription. So can you talk to us a little bit about the medication management?
Yes, absolutely. Again, if I understood your question correctly, we're talking about individuals who are discharged from the hospital with psychotropic medications. What we do in the while they're in the hospital is, one, we're trying to figure out, do they have a funding source? Is there a way that they can afford their medications? And if they cannot, then we have actually what we call a customer service representative who is in the hospital, who meets with that individual and puts them, if they meet the requirements for patient assistance. So there are a lot of pharmaceuticals that have free or very low costs. We also have several of our medications that are on low cost, like $4 a prescription. And again, if they can't afford that, then we work with our dollars that we receive through Lutheran Services to actually pay for their medications. The customer service rep works with them, gets them. What we would prefer is that an individual would sign up for our mail order program so that they would get the medication sent to their home. But several individuals, again, you have to imagine what a Baker Act is like. Many individuals come to us and they say, I did not need to be Baker Acted. I don't know. And I used to run our hospital and I would spend a lot of time on the units, and an individual would come up to me and say, I don't know how I got here or why I'm here, but I'm not crazy. I was like, okay, no one says you are, but let's think about what events got you here. So whatever it may be, they were then escorted to our facility in handcuffs in the back of a sheriff's office or sheriff's car. So a lot of them are already angry. So many times they go through these up to 72 hours and they say, I don't really want psychotropic medications. So we have several things that we try to put into place. One is to get the medication sent to their home. We also give them 30 days worth of medication when they're discharged from the hospital. So that gives them 30 days worth of medication. Whether they take it or not, for those individuals that are very resistant, then we're going to set them up with care coordination or case management once they get back into the community. Now, some individuals are a little more resistant or more, we call them familiar faces. They've been in and out of our facility several times. So they're going to get a care coordinator that'll work with them up to going to the home to make sure that they're taking their medication. For individuals that may be taking their medication, may be falling off, we also have 7-day follow-ups with our providers to see how well, because you're absolutely right, 72 hours, depending on some medications, they may be discharged and the medication is not as effective as the prescriber thought it would be. So there's that 7-day follow-up in which they're going back, evaluating, is it working, not working, how are you feeling, whatever the case may be.
And is the follow-up in Citrus County or is it back in Leesburg?
In Citrus County. In the beginning, and again, I've heard all of the misinformation. In the beginning, we did have people, this was during the whole, right before COVID, we did have people coming to Leesburg to get their follow-up appointments. Didn't work as well as one could imagine because a lot of the people we're working with are indigent or can't afford. They have to make a decision as to whether to feed their family or put gas in their car to get their medication, and we never won that one. So I can tell you now that they are scheduled in Citrus County through a telehealth service with one of our providers.
Excuse me.
Go ahead.
Mr. Hankey or Dr. Hankey?
Mr.
Mr. Hankey, I do appreciate you talking about misinformation because there was an email that went out to get people to email us and to come to this meeting that said Commissioner Bays and I did not support a Baker Act facility. That is not true. That is not what happened. You watched the meeting. It was a discussion, and so I want you to know I appreciate the misinformation, and I take it with a grain of salt, and I hope you do too, that all 5 of us have stated over many times, many meetings, that a mental health facility, Baker Act facility for Citrus County is a big priority for all of us. So thank you for keep reminding me about misinformation.
Yeah, there's a lot out there. And I watched the meeting not once, not twice, but 3 times. Because what I wanted to make sure is that I'm here and I will be reintegrating myself back into the process. And I want to assure you all that I can be a resource. If you have questions, if you have, is this really happening or not? Very transparent, I'm going to throw it out there. Yes, we're doing it. No, we're not. There are things about the system that aren't working. And when you look at how it all came to be and where we are today, unfortunately, COVID really kind of put a halt on a lot of our movement forward. I used to spend a lot of time with the county commissioners as well as individuals in this community, the stakeholders. I used to have town hall meetings with a lot of the stakeholders, and I remember our very first one, there were close to 100 people. And there were a lot of, people need to be educated because unfortunately mental health has a stigma, and we have to just make sure that people have the most accurate information out there. So
Absolutely. And COVID was the perfect storm for mental health. It put the services aside, like you said, had to pause. But then during COVID, a tremendous amount of people were dealing with mental health. Perfect storm. So we are where we are now today because of COVID.
yeah, absolutely, absolutely. So I will leave you my contact information. You feel free to contact me anytime. Be glad to have any discussions or make sure that you have the most accurate information available
Thank
as
you.
to what we're doing and what's going on. Because another thing that I heard was, are there other services that are happening in the county? And we do have a lot of services that are going on, and we're hoping to build on them. As I mentioned, we came into the county with a Lutheran contract, some match dollars from the county, and then we have built up our inventory of services as well as identify other funding. When I first came into the county, there was a lot of discussion. Well, they're going to take all of our dollars and go to Lake County. So no, we're not going to do that. And in a few slides, I'll show you how we have been able to bring in other dollars to Citrus County for the residents. Kind of on that same line, some new additions since January 2019 when we came in. We have, as you mentioned earlier, the medication-assisted treatment for individuals who have opiate or substance misuse. We can provide those services. The central receiving system, and this is really where the Access Center came into mind, the Beverly Hills facility. The central receiving system is a concept through the Department of Children and Families, and it's really focusing on how quick can we get law enforcement into the facility and get them out on the roads again. So that's why we said we would do the transporting. And again, we'll just throw it out there. That has not worked as smooth as we all thought it would either. And we continue to work with law enforcement. There are some issues with the facility. There are some issues with the severity of individuals that are being brought to us and other types of things. We have brought into the community a Children's Community Action Team, or a CAT team, working again with the most severe families. We don't want to take the children out of their homes if we can avoid that. So we actually have a team that goes into the homes and actually works with the families, identifying what the family needs to be a productive family instead of one that is dysfunctional. In-home and in-site services, and that includes counselors in the school settings. We are in several schools here in Citrus County, and that continues to grow. The family intervention services, again, the focus on the family. We are actually working with families in their homes. We're not taking them out of their homes. We're working with them in their homes. A child mobile response team, that is a team of individuals that are available to go to the schools to kind of thwart a Baker Act from actually happening. It's really traumatic for someone to go through a Baker Act, especially a child, and we really want to be able to get in with law enforcement or the school resource officers and try to thwart that from actually happening. We also have a children's substance use residential. It is located in Lake County, but we offer that to the Citrus County individuals as well. It's about a 45-day program, and we work with the families while the child is in treatment with us, and then provide case management and other overlay services. Adult therapy, our adult mobile response team, that is something that's relatively new. The mobile response team, we're trying to work, we're really trying to figure out how we're going to roll it out here in Citrus County so that it's more utilized. But we really want to be part of that when there is a crisis, sending out a team in order to thwart that Baker Act so that we can try to come up with alternatives instead of the Baker Act. Psychosocial rehabilitation, we have several people that show up every day and we give them life skills training and some other types of services. Peer recovery support, we have a group of individuals that work with individuals in treatment. Who knows the system better than someone who's gone through the system? And they act as an encouragement as well as to help them get through our system of care. And then a substance abuse response team. Instead of, again, having people get into crisis, our substance abuse response team works with individuals in the community trying to keep them out of services. So it's not all about getting people into a Baker Act receiving facility, but I hope you can see now that whole system of care and other services that we're able to provide individuals to keep them out of a Baker Act receiving facility. However, a Baker Act receiving facility is needed. So it's not that we're trying to put it out of business so there is no need for it, but there are individuals that, and I have seen, I've worked in this field for many, many years, I have seen individuals that have put under a Baker Act that really don't meet that criteria. So we're really trying to work with our stakeholders in order to avoid that. So the next slide.
Madam Chair,
Yes,
I
sir.
got a quick question. Rick, I sit on the DJJ board for District 5, and at our last meeting in February, there was some discussion. I wish I'd have taken some better notes on it, but there was some discussion there about a youth substance program that was getting very high reviews. It almost, I don't know that it was a new program, but it was something that the representative from that area went to great length to talk about. Is that this children's substance use? Do you have any idea if that would be the program that is taking place? It seemed to be there's a lot of group discussion about it.
I don't know if that was the discussion or our facility. I'd like to take ownership if everyone thought it was a great facility, but I can't do that. I can tell you that we have a little over a year in operation, and we have received very positive results because the idea, traditionally, kids go into a substance, and I'm going to say it's a co-occurring because we're also dealing with the mental health issues. They go into the residential, no one really pays attention to the family until discharge time. Well, there's a lot of dysfunction that may be happening in that family, so we bring the family in while the child, and we're actually providing therapy and counseling services for that family while the child is in our residential program. And we're finding that there are things that may be going on that are affecting the child's substance use. So when that child is discharged, again, we're not keeping them for long periods of time because that's not productive either, that we are then reuniting them with the family, and then we're continuing to provide those therapy services for as long as the family feels that they need it. So,
well, it was your facility. LifeStream was mentioned specifically, and if you're saying that this is out to, or this has been going on for about a year or so, I would say that's probably that program. But just at our February meeting, there were some pretty high reviews for it there amongst the board. I
Thank
just
you.
wasn't sure if that was the program, but it sounds like it was.
Yeah.
Thank you.
So next slide, please. What I wanted to do is show you the differences between, the first year was really trying to get services up and running. FY20 was the year that we were actually in operations. We served over 1,700 individuals, provided over 36,000 individual services with an operating budget of about $4.5 million. And just kind of some demographics. I think it's important to understand when we did the presentations to the strategic planning for elected officials, the very first year, everyone in the room was just surprised at what we were actually seeing in Citrus County. And we continue to see that. We see higher drug use than other counties that we work in. We see a lot more severe mental illness than we do in other counties. And we don't have an explanation as to why, but I think it's important to know what our demographic is. So when you just look at, it's kind of the 65 plus, 26 to 50 really is the demographic. We work with a lot of individuals in that age bracket. We are working with, individuals for the most part that are unemployed. We do have some individuals that come to us with full insurance and full employment, but that is not the norm. And then when you look at the mood, the diagnosis that people are coming in, it's mood disorder followed by substance misuse. Yes.
Mr. Hankey. Commissioner Davis.
Thank you. The client employment seems to be missing a lot of points. One of them is 92 back in 2020 and 91% in 22. Is that part-time that's missing? There's something missing.
Can you state that question again?
Okay,
please?
so if you add up
employment-
all the client employment numbers, 16, 13, 6, 3, 6, 22, 26, you get 92 percentage points for 20. And you get 91 percentage points for 22. You get 99 on client diagnosis, but I can consider that a rounding error.
Mm-hmm.
But 92 and 91 are pretty far short of 100%. So you're missing a category, and I'm wondering if it's part-time, since that seems to be something that's missing in the descriptions.
Well, part-time is
No,
6%.
Oh,
part-time-
no, it's right there. Never
Yeah,
mind. So you've got
28.
other, and you've got unemployed. So that
Yeah.
should be your two catch-alls.
I'll go back and take a look at those
Okay.
numbers and let you know if it was a rounding or not. Self-employed, we'll go back and just make sure that we
Okay.
have that information for you. So moving on to 22, next slide, please. Served 2,500, a little over 2,500 individuals with 56,000 services with $7.6 million budget. And as I mentioned earlier, and I'm going to talk about this in a little bit, those are the extra dollars that we've been able to bring to Citrus County to pay for these services. As I mentioned at the beginning of this presentation, we do receive dollars from Lutheran Services for our indigent population, and we do not, we serve all individuals. We do not refuse services based on the inability to pay. And the demographics haven't changed that much. I can tell you that in the last year and a half or so, that we have seen more fentanyl use and more synthetic drug use than we have when we first came into the county. So next slide, please.
Madam Chair.
Commissioner Bays.
So where did the 7.6 million come from in 22 to operate?
Mr. Terry is going to talk a little bit more about the funding structure. Those were, some of it is from SAMHSA grants that we wrote and we were awarded for Citrus County, specific to Citrus County. Some of that is we went back to our Lutheran services and identified some gaps in services here in Citrus County, and we requested funding from our managing entity in order to provide those services. Some of it was increased as more people started coming through services, getting on insurance panels and making sure that we could do that piece of it. As you provide more services, especially with the indigent population, we have what is called a SOAR processor, SOAR. And that individual works with individuals who are identified as indigent to get them entitlements if they are eligible to receive those entitlements. So that has helped, because someone may come to us as homeless, not able or have no entitlements, but they are eligible for entitlements. So our SOAR processor works with them in order to get those entitlements to that individual.
So if I looked at 2020 and took your number of clients by the amount that your operation was, why is the cost going up? It was $2,586 per individual in 2020, and in 2022, if I did it, it's $3,018 per individual.
I'd have to go back and take a look at that, and we'll have our CFO take a look at that and give that answer to you.
You would
I
have to
think-
come to the microphone.
Yeah,
Please, ma'am.
what she is saying is as you add more services to the continuum, some of them are more costly than others. For example, we know that our hospital is more expensive than outpatient treatment. We know that our residentials are more expensive. It could be the number of people that are going into those services, where in the first year of operation, we did not have full access to all of those services.
Okay.
But we will go back and respond to that. Next slide, please. Basically, what this is showing is that the number of services and number of individuals served here in Citrus County has gone up. That there definitely is a need for all of the services that we are providing here in Citrus County. Next slide, please. In FY23, the year that we're currently in, as I mentioned to you earlier, we went through a community needs assessment, and we included some stakeholders here in Citrus County, as well as the other counties that we do business. And there was some identification of gaps, areas, services that are not being met here in Citrus County. So what we do with that information is we look to see if there are dollars, because dollars are not plentiful in our field. You know, as you may know, that the state of Florida is last in the entire nation as far as per capita spending for behavioral health services. It's gone up. You know, it's either 50th or 49th or 48th, but we are in the bottom. And in the area that we're located in, this region is amongst the bottom quartile for funding within the state of Florida. So there aren't a lot of dollars. We can't just approach anyone and say, hey, we need a couple $1 million to do this or whatever. We have to be very creative. So with some of the needs that have been identified, we're looking for grants and other opportunities for us to actually bring those services into Citrus County.
You have to explain that to me, because I'm a business owner and you are a business, and you said there's not a lot of dollars, but just Lutheran services alone, $260 million a year. Their net assets their total assets, there's 56 million, and their net fund balances for the end of 2020 was almost $12 million. There's money in mental health.
Well, I don't know if the information that you have is Lutheran services, because they're a lot more than just the behavioral health side
Well,
of it.
this is their 990 Lutheran
So
services.
their behavioral health is a subdivision of the corporation, Lutheran Services, which provides services all across the state. The Lutheran Services, I believe, behavioral, I don't remember their name, that's only a portion, and they get their funding through the Department of Children and Families and through some other appropriations. So that number I do not believe equates to the Lutheran Services that is our managing entity. That sounds more like that's the statewide organization.
It is a statewide organization, but the one you're dealing with is under this umbrella, correct?
Yes. Mm-hmm. Yes. And our funding is pretty much prescribed. Again, they work with all of the agencies from Jacksonville down to, I think Lake is the bottom, all of the rural counties, all the way
Oh,
up to the Georgia
I understand
border.
what they're doing. I'm just saying, to say there isn't any money in this industry, I'm having trouble wrapping my brain around that. Because I'm a numbers person.
Mm-hmm.
I look at the IRS forms. That
Madam Chair.
doesn't lie.
Madam Chair?
Yes.
A couple things that I'd like to interject with your question. I think that I believe all 5 of us here are in private business. We don't have to accept clients that can't pay. They do. And that is the time that I personally spent working in our county health department. You learn a lot about the client mix, those who can pay for services and the many who cannot pay for services. And you're required to serve them all regardless. In our private businesses, we don't have to do that. If they can't pay the bill, then you don't have to serve them. So that's a big difference between the businesses that we each own and the business that they run. And whatever the number is, if the number is 60 million, 80 million, 100, and what you brought up statewide, 260 million, if it costs 340 million to run the operation statewide, and the revenue's 260, there's no money in it. So it's all relative to what it costs to run those organizations. Rather than just throwing numbers out there, we need to look at what is the cost to run it. What does it cost to see all of those people? And there are many in our area who can't afford these services. Thankfully, we've got organizations that are required to provide for them. That was all.
Commissioner, I hope you're not trying to say I don't know how to read an IRS form.
No, not at all.
Because you said, I said the bottom line. I understand what's expenses, I understand what's gross, and I understand what's net. I also understand assets.
Right.
And what I read you is filed with the IRS. I'm talking about Lutheran services. I didn't go into yours, I didn't do that. But to say, oh, there's no money in it, the bottom line is $12 million statewide. I also understand that there are clients, thankfully, that you take that can't afford it. The most vulnerable need these services. But what I understand is that's where you get 1.5, Senator Baxley got you 1.5 and you got what, 1.5 from Citrus County. I'm hoping that money pays for the people that can't afford or have no insurance. I don't understand why they don't have Medicaid if they're not insured at all, but that's something you would have to explain. But wouldn't that money that you're getting from the state of Florida help alleviate the debt of people that can't pay?
That helps offset the cost. You're absolutely right. And I just want to go back to the Lutheran. That Lutheran Services is a very large organization. They do case management across the state. They're involved in child welfare. They do refugee placement. They have a whole bunch of business lines that fall under that umbrella. The managing entity that we're working with, they prescribe the dollars that we get in our contract. And we have to work with that managing entity, which is a subsidiary of the larger corporation. So that may be for the larger corporation, and I don't have that in front of me to speak to that.
And the only reason why I said that is because you said there isn't any money in it.
There is no money in the behavioral health. For an organization like ours, what we have to go through to identify funds for services, for whether it's indigent or not, is very difficult. The legislature determines how much is going to go into the budget, and then that goes through the process, then that gets split out throughout the state. So each area gets a set amount of dollars. So I can tell you up until recently, we went many, many years without an increase in our rates for it didn't matter that people wanted more than what we were paying them for
I'm
wages
not saying
and
you
whatnot.
made a ton of money.
Yeah.
I'm just saying there is money in it.
I think
And
in
we need to
social services, perhaps, I can tell you that in behavioral health, it's been very difficult for dollars. They're just not plentiful. Now, the legislature has increased, and there's been more focus on behavioral health, so we're seeing some dollars that are loosened up. But I think the question was, how did we find these additional dollars? We really look to see, are there grant dollars, SAMHSA grant at the national level? Can we work with some of the national agencies? Can we work with some partners? How do we actually bring these services in to,
Madam Chair?
And one more thing, and I'm a researcher, and through my research, you do have a foundation, and I don't know how much that foundation in 2020 they had about net assets, fund balances were just about $500,000, just over $500,000. Is that also helping to fill in the blanks where you need the money to help someone? Is that what the LifeStream Foundation is? Okay.
and I will share with you as well, that as an organization, we provide services. There are programs that are underfunded. But because they are so important to the community, we know that some other services may pay for themselves and have a little bit more. So it's constantly balancing that piece of it. We don't want to close down some of the, and I'll give you examples of some of our prevention, some of our intervention programs that don't pay a whole lot. But we don't want to close them down because there's so much added benefit to the community. So the foundation helps to offset some of those costs as well as some of the other areas that are loss leaders. And we just don't want to close them down because the community needs those services.
I understand that completely.
Okay.
I do.
Madam Chair.
Commissioner Finnegan.
Just if I can help with this a little bit, two things. One, any nonprofit, Lutheran services, and then it breaks down to behavioral health, I understand. If we don't see some sort of assets at the bottom, that would be worrisome because every nonprofit should have enough to carry on. It used to be 3 to 6 months. I would like to say 6 months to a year. They need that because if funding drops off, you can't just cut off services to any of those populations in need, whether it's behavioral health, refugee services, et cetera. So it's nice to see a cushion. They have to have a cushion to function. And just maybe a parallel, like in the county, we have people say, you have a $400 million budget. Why isn't there enough money for roads? Because it breaks down into, we have to use that money for other things. So just like parallel for behavioral services, they may have money in the bank, but there's only so much for services and they have to have so much for reserves. So if that.
And again, I don't need you to explain that to me. I completely understand that. $11 million, $12 million is a little more than 3 months cushion.
3 months would be the low end. You wouldn't
No,
want
but I just don't,
that's not healthy.
I think I understand how that works. And, I'm just pointing out, you can't say there isn't any money in this. What you might be doing is God's work, but in any industry, there's always some catch. And we need to find out where we can get the money and perhaps maybe hit Lutheran Services a little bit to help us out.
And we do. We try to, if there are needs, we really go to all ends of the earth to try to find funding for it. But I will throw out, we're here today to talk about a Baker Act receiving facility, and that has gone on forever and ever to get commitments to move that forward. A lot of red tape, a lot of things that we have to go through, but LifeStream is willing to do that, and that's why we've been able to bring additional dollars to fund the services here in Citrus County. So we don't leave any rock unturned. We write federal grants. We do what we can do in order to meet the needs of the people here in Citrus County, just like we do in the other counties that we're working in. So kind of moving on with regard to where we are in 2023, there are, we kind of, go back one, please. Just wanted to bring to your attention some things that we have started implementing. They're not fully implemented, but they were as a result of seeking other funding sources as well as federal grants. Our Assisted Outpatient Treatment Program is a Baker Act program for people on an outpatient basis. So we're used to thinking Baker Act, you have to be in a facility. For individuals who do meet the criteria, we can provide a team that works with individuals to keep them out of a Baker Act. And so we're in the process of implementing that here in Citrus County. That is a SAMHSA grant that we wrote specifically for Citrus County in order to help us with this population. We have a team that works with that individual, has its own provider, its own therapist, its own nursing staff, its own peers, its own care coordinators. So for individuals that have several Baker Acts, we're actually working and going to them in the community to try to keep them in the community as much as possible. So it's not that we want everybody to go through the Baker Act. We are actually looking for alternatives to the Baker Act. The CCBHC is the Certified Community Behavioral Health Center model. It's across the nation. Florida has not adopted it totally, but we did receive a federal grant for just Citrus County. And what that'll allow us to do is to get people into services more quickly, to provide more of that care coordination that I talked about, which is so critical, because maybe, for someone who does not have a behavioral health issue, making an appointment to go see a doctor and showing up is not that difficult. But for many of the people that we work with, that can be a very difficult task for them to try to maneuver through systems. So we have care coordinators that will even pick them up and take them to appointments to make sure that they are meeting their appointments. It'll also allow us to bring integrated primary care to Citrus County. A lot of the individuals that we serve have tremendous health needs, and a lot of them will not reach out and go to primary care. We have primary care facilities in Lake County that have been very successful working with this population. So we will, through this funding, be able to bring that into Citrus County as well. And as I mentioned earlier, the adult mobile crisis. We are working on how can we best partner with some of our stakeholders to prevent the crisis from happening in the first place. What do we need to do? And that's just in the early stages. So we're reaching out to our stakeholders and saying, what can we do? What's missing from the system of care?
Madam Chair,
Commissioner Bays.
can you explain to me what a level 1 bed is?
Yes. In the DCF licensure world, there are different levels depending on the needs of the individual. So a level 1 is your highest need. That means that you are going to be serving people with medical, and what I mean by medical is that they can't take their medication themselves. It needs to be supervised by a nurse. It also means it's a higher level of care. So we have to have higher staffing patterns and other types of activities. Level 2 is just step down level 3 and 4 and goes all the way down. So in the new campus, we are working on opening up a level 1. This is a step down for people that are coming from the state hospital. So we implemented this model about 12 years ago in our system of care, and it has been very effective. I will share with you that individuals who come to the residential usually are from different parts of the northeast portion of Florida, and we either place them. These are not individuals that after their stay with us, which could be up to a year, are going to be released into the community. These are individuals that will need some sort of institutionalization for the rest of their lives. So they will either be in a group home, an assisted living facility, or something like that. So not everybody for this facility will be a Citrus County resident. They will be housed here, we will treat them, and then they will either go back, and I can tell you that from our other programs that we operate similar, they go back to their home county, which could be Duval or whatever the case may be. I can't think of any that have stayed in Lake County. Usually the assisted living facilities, I know Gainesville has several, that's where these individuals are placed once they are stable.
So it says new services implemented in '23. Where is this, where is this located?
This residential will be at the new campus. On that campus that
So
used
it's
to
not
be
in,
the centers,
it doesn't exist right now?
it does not exist, no.
Okay.
We are in the process again of licensure. Licensure takes a long time. And so we are in the final, as a matter of fact, yesterday ACA came in and did their final walkthrough. So they have given us approval to open services.
And for a lack of better terminology, will this operate like a methadone clinic?
No, we do not do methadone.
Well, the other
Do
two,
not
whatever
do
the other
methadone.
two, whatever they're
Yeah,
called.
Suboxone.
Yes.
Yeah, this is mental health. These are individuals that have mental health issues, but we are not a methadone provider. And just for education, Suboxone, we only use the oral. We don't use the pills. The strips, I'm sorry, the Suboxone strips, because they have no street value, they can't sell them. Now, I guess you could put it on your tongue, but by the time you got out into the street, it would be gone. And Vivitrol is an injection, so there is no way that people can, I guess people could figure out anything really, but nothing surprises me. But we have chosen to go that route so that there is no street value or people can't go and sell it. Methadone does have a street value.
And you might have answered this already, but what is the funding sources to open and operate this?
The residential was through we submitted a statement of work to Lutheran, through the state.
Okay.
State funding.
So we circle back to that. Very good, thank you.
Yes.
You could have told me that in the beginning.
Well, there was a little bit more to it than that, but okay.
You probably already said this, but you have a facility in Lake County. Is Leesburg Lake County?
Leesburg is Lake County.
And do you have a facility in Marion County?
We have a small operation in Ocala.
Do you have beds?
No,
No, okay.
we operate outpatient substance abuse as well as 2 other programs.
Is Leesburg the only facility that has beds that you have?
That is where our psychiatric hospital, our detox, as well as our addictions receiving facility are located. We do have several other residential facilities. We have, it's not so new now, but in Claremont, South Lake, we have a residential facilities there, as well as the one that we have purchased here that we just remodeled and getting ready to open up
But beds, it's just all in Leesburg or Lake County?
at this time.
Okay, and you do have the level 1 beds in Lake County?
Yes.
You said it's been successful?
Yes.
And you intend to do that also in Citrus County?
Will be, yes, that
Yes,
is our
okay.
proposal.
Thank you. Commissioner Davis?
Just for my overall knowledge, point of clarification, you've thrown out the term psychiatric hospital several times. Is that used interchangeably with level 1 residential?
No.
Okay, that's even more.
Kind of walking through, yeah, you have your psychiatric hospital,
Okay.
which is, and they're all licensure categories,
Okay.
but the psychiatric hospital is the most regulated, it's licensed as such. Then you get into your crisis stabilization units, which really comes down to different licensure, different funding sources. When you get from there, you get, within that is also our detox unit, our addictions receiving facility unit. So those are all within that acute care, if you will. When you get into the residential realm, there is a license 1, license 2, license 3, 4, and 5. Depending on the population you're going to be working with, depending on what the needs are of the consumers that are going to be staying there, as well as the staffing ratios and what you have to have. A residential level 1 is your highest level. So that requires more nursing staff, requires more medication management, meaning the nurses are going to administer it.
Yeah, I understood
and it
all
goes
that
all the way
part.
down.
So essentially it's the 3rd level down now. So you've got psychiatric hospital, and then you have, did you say detox facility? And then
Crisis
or
units.
Crisis unit, and then level 1. Okay.
Yeah, in simple terms.
Yeah.
Are you,
Yes, ma'am.
so the license for Citrus County will be what level? One. Okay.
Yes. Mm-hmm.
Very good.
Yep.
And how long has the process been for you to get a license for Citrus County? You said you're in the process. How long have you been working on that?
It all varies, to be real frank with you. In order to apply for an ACA license, we have to go through fire inspections, occupational license, and all those other types of things. We then submit to ACA, and then ACA, they do a desk review, and then they actually come out and do a site visit. It can vary. The residential has taken us about 6 to 8 weeks. The outpatient has been a little bit longer.
And the level 1
That is the level 1.
is the residential?
Yes.
Okay.
Yes.
And that's 6 to 8 weeks you've been working on that?
Mhm.
Okay.
Yep. When we purchased the facility, of course, there had to be some renovations, bringing it up to speed and bringing it,
Sure.
making it
Up to code?
dated.
Yeah.
And so that took a little bit longer due to, if you try to build a house or try to do any renovations right now, it's tough and it takes a long time if you can get a contractor to show up. So we went through that piece of it, and we're in the final stages for that campus.
Very good. Thank you.
Madam Chair?
Yes, ma'am.
So receiving your ACA license for the Citrus County facility, what entitlements does that provide to you for reimbursements from the state? I mean, is that is it a funding source that it qualifies you as a funding source?
Let me back up a little bit on that. It allows us to operate. You can't operate a facility without the license. You have to go through this process. So if we were to open it up without the license, then we could get fined and those types of things, which is not, that's totally against our operational model. So that allows us, one, to open up. It also allows us to bill Medicaid and Medicare if it is applicable. So we go through that process as well, but we have to go through, get credentialed, and there's a whole piece to that side of it. But the license itself says that we can open the doors, and it also, if it's an entitlement, which I don't think it is, that allows ACA to come in and do reviews, allows them, the one thing that I maybe failed to mention, but I want to impress, is that with regard to all of the regulatory bodies that we are licensed with, they, if someone, especially in our hospital, says, I'm going to complain, they have the right to complain. And they can complain to ACA. ACA then comes out and does an investigation. And I can share with you that we are 99, I won't take the whole 0.5. Those complaints are not founded. They come out, they do a review, but anyone can complain about anything in the facility at any given time. And I can tell you that as a former hospital administrator, it was not pleasant to come in. I knew that they would be there by 9 o'clock in the morning. If it was 9:15, I'd say, it's going to be a good day. But they would come in and we'd have to prove beyond a reasonable doubt that the complaint was not valid, and very proud of the fact that we can demonstrate that these are not valid complaints. Not to say, and I do not want ever to portray a utopia that we are perfect. We're just like any other organization. Things happen, but I think that we do a very good job dealing with it, and through our process improvement thing we have in our organization, that we address those issues.
And you're ACA licensed in Leesburg now.
We are ACA licensed. We are DCF licensed. I could give you a list of all the licenses we have. Heavy regulated. All right. So moving on to the next slide. This is something that you asked before. We currently have location in Lecanto, the second location in Lecanto, as well as in Inverness. We have our children's outpatient services. That's where our school-based programs are. And in Citrus County, or in Crystal River, we actually have outpatient, and I mentioned that to you earlier, that we will be moving those to the new campus in Lecanto. When we came in, there was only one location in the county for services, and we really felt that we needed to cover the entire county. And that's why we opened up the different facilities, and we will continue with that. And again, we have an active process with the stakeholders. What are the gaps? What's going on in the county? We have a lot of data collection. We're looking at data. We want to see, are there any trends, things that are changing, so that we can best meet the needs and the best of our ability.
Could you provide that data to us?
You tell me what data you want. Yes, I will provide whatever data.
I would like to see all the data, what you're looking at that develops the trends.
Okay. All right. Next slide, please. And as a result of that data, what we are seeing here in Citrus County is higher utilization of offered services. When we projected coming in here several years ago, we did not project. We projected there would be about 5 individuals that would use our acute care services, our hospital, on any given day. We have exceeded that. We're somewhere more on the average of 10 to 12 individuals. Children's services, we have children coming left and right into our crisis stabilization unit. We have higher than average substance misuse. We have a lot of the opiates, synthetics, and the fentanyl mixed. When people are coming to us, and I really believe that when people are brought to us in the access center that are acting psychotic, we had to change our drug panel in order to capture the fentanyl and some of the other types of things, because those were not psychotic symptoms. Next slide. Some of the demographics, we're seeing more females slightly than males. We are, when you look at the ages, we are really that 25 up. And the drug of choice, as you can see, is other opiates and synthetics. And that is a difficult addiction to work with. Next slide. Yes.
Mr. Hankey, I see that this is 2020 demographics for female, but the latest study showed that teenage girls have 13% suicide rate, 54% of sadness, or I don't call it mental health, but it is on the rise. So I just wanted to say that because it just came out yesterday, and it's heartbreaking. And to see that it was 52% in 2020, now it's at, well, that's it being served. 54% of the nation of young women have suicidal thoughts, have attempted suicide, or in the process of trying to figure it out. So, I mean, that's why it's so important that we get this right.
Yes. And we are actually seeing an increase in the number of younger females being brought to our crisis stabilization unit. COVID has had a tremendous impact, not on the mental health of all of us, but more so on the 18 and under crowd. We're seeing a lot of depression, a lot of anxiety. I knew when I was growing up, every now and then we would do a bomb drill where we had to get under the desk because one day it could happen. I cannot imagine being that age and being afraid to go to school because someone's going to shoot it up, or going to the mall and being afraid that someone's going to shoot people. I just can't imagine.
Well, and social media, they're sad, and they see all of the people that are so happy and have their life together.
Exactly.
Social
exactly.
media is a killer.
And again, with if we saw a sharp increase on those, we would try to find some programs that would actually address that. In-school programs, do we need to talk to our therapists? Do they need to concentrate more on that? Do we need to do some types of increased trainings on what's going on, those types of things? So that's how we use the data in order to form how we provide services.
So you already have that pretty much in the works since 2020 for young women, the high school, teenage girls.
Well, I would say that in the last 6 months, we've
6
made
months,
more of an effort in that area than since 2020. That's where we have seen individuals coming to our facility that have those needs. So
Very
yes,
good.
in the last 6 months.
Very good, thank you.
Madam Chair.
Commissioner Bass.
So these statistics, are they based on just 2020 or 2020 to 2022?
2020 at this point.
Okay.
Mhm.
Madam Chair,
Yes.
might I? On the previous slide, I believe I heard you say that you've changed your drug testing based upon the fentanyl use, the mixtures at the Access Center. So am I to understand that during the initial assessment, when you're evaluating whether or not to Baker Act someone at the Access Center, you're drug testing them?
Yes. Yes.
Thank you.
Yeah, there are a couple of tests that go on. One is a pregnancy test for women, and the other is a drug test because we don't know, just because someone is brought to us under a Baker Act, we cannot assume that their symptoms are psychotic in nature. It could be drug induced. And I will tell you that right before COVID hit, we started seeing some very bizarre behaviors that we had never seen before. So said, we've got to do something. Something's just not right, because we would get them in, treat them for the symptoms they were presenting under, and they wouldn't respond. So we expanded our entire intake process to include drugs of choice, the synthetics and the fentanyl. So we really increased our drug panel to be able to test for those types of things.
And so you're doing that drug testing at the Access Center in Beverly Hills before you decide whether to Baker Act them and take
If
them to
it's-
these-
if we
I
can.
finish my question.
Yeah, if we can.
Okay, thank you.
If we can. Because sometimes people come to us and they're very psychotic and they're a danger to themselves and to the staff, and we've got to get them to Leesburg as quick as possible.
Thank you.
And next slide. Basically, it just shows the demographics of where people are coming from. The Homosassa Springs, and Inverness are our top two, followed by Beverly Hills and the Crystal area, or Crystal River area. And then finally, I think I've said this probably 12 different ways, but kind of to summarize it, next slide, please. Again, that service expansion. We know that there is a need for inpatient and for residentials. Again, when we talk about the Baker Act receiving facility, that's one small piece of, Baker Act receiving facility says that we can receive Baker Acts. So that is where we're looking to expand other residentials, looking at the substance use disorder services, crystallizing that and making sure that we're meeting all of the needs, because that is ever changing, as well as the psychiatric outpatient services. Want to strengthen that piece of it. As I mentioned to you earlier, I'm talking to a couple of providers so that they will be located here in Citrus County.
Madam
So-
Chair?
Commissioner Bays.
So you're going to expand inpatient and residential. Do you currently provide substance use disorder services now?
In Citrus County, yes. Yes, we have therapists here.
And do you also provide psychiatric outpatient services currently?
Yes, we
in
do.
Citrus County?
Just want to expand them right now. With regard to psychiatric services, the substance abuse are provided here face to face. If a person prefers telehealth, we do telehealth, but the psychiatric outpatient is primarily done in a telehealth environment. I'd like to have someone here. Would really love to bring in a child psychiatrist. If you know a child psychiatrist, please let me know. There are not very many of them these days, but I would like to see more child mental health services here in the county, face-to-face versus the telehealth. We really need to do, as Commissioner Kennard mentioned, I think the success of our residential program that we have in Lake County is because we are working with the entire family unit, not just the child and then the family. So I think we need to do more of that here in Citrus County. So I'm going to turn it over to John. If there are any questions before I sit down.
Yes, Ms. Lynn.
In trying to differentiate between the inpatient and the residential, earlier you talked about the acute care, which was the psychiatric hospital, the detox unit, the addiction receiving, and you identified those as more acute care. Are those the types of things that would be included in the inpatient as compared to the residential, which would be like the level 1 through 5?
Yes, ma'am.
Thank
That's
you.
correct.
The Baker Act facility, very early on you said there is you take them to Leesburg, and then how are they getting back to Citrus County?
First is if they have a support system or a family that is able to pick them up, that's what we would prefer, but not always the
Sure.
case. We then transport them back to their home.
Okay, so if we have that and there, you can't turn down any county for services, if somebody brings somebody to you, you don't turn them down, even if you don't have a contract with them. So somebody comes from Pasco to Citrus County. Will Pasco be responsible for taking back the Baker Act patients, or are they just stuck in Citrus County?
Now, so
How does that
under
work?
the Baker Act, if they came to us under the Baker Act, so if they came to us under the Baker Act, then from Pasco County or wherever the case may be, we would do the same type of thing. Reach out and see if there was a family member or support. If that's not available, then we LifeStream would do the transport back to their home.
Okay.
Yeah.
And if
Is-
they don't have a home?
Then while they're in the hospital, we have what are called recovery specialists that work with the individual to identify their needs. And if they say, look, I'm homeless, then we would have more of a conversation. And I could say a lot of what ifs, but the goal is to get them into a stable housing. And sometimes they say, I just want to go to a homeless camp. I just want a tent to be in the woods or whatever the case may be. Or I would really be interested in further looking for housing. We have in Leesburg right now, we call it our CRS. Don't know what the acronym stands for, but that is our resident, for people that have housing issues or they have other issues that we can try to solve to get them back into the community. Because we really do not like the revolving door concept of people using the hospital or our acute care services as a social services agency or whatever the case. And some people will do that. They keep coming back, and if it's cold, they show up. If they run out of food, they show up. They'll get themselves Baker Act, and sometimes it's 3 or 4 days after they were discharged, and that's really not what we want to do. So we have a recovery team that identifies, and then, as I mentioned earlier, we have peers and care coordinators that work with these individuals to get them placed somewhere so that they can, our goal is really productive citizens in our communities. We really don't want them coming in and out of a Baker Act or getting to the point where they commit crime and other types of things.
Very
So
good.
that's just a general example of what we would do.
Madam Chair.
I just have one more question, and I'll give you the floor. So we talked about what the state is supplementing or allocations to you. Marion County, 1.5 this year. Senator Angola has asked for $2 million. Senator Baxley, he covers Lake and Marion, so that's the 1.5. Is there any other counties that you deal with that the senators have put in an appropriation for you?
I'm going to turn it over to Mr.
Okay.
Cherry in a moment, and he
That's
can
his.
answer that question for you.
Okay, thank you. Appreciate it. Any other questions?
Yes, ma'am.
Oh, sorry. Yes, Commissioner Bays.
So, page 8 and page 13, there's roughly almost an 800 person increase from 2020 to 2022. And if you could update page 13 to be reflective of 22, that would be awesome.
All right.
And then the other thing I think would be helpful is if you could give us a breakdown for Medicaid, Medicare, private pay, what you're seeing that's coming out of Citrus County. I think that would be very helpful for us.
Absolutely.
And I would add in there, no coverage at all
Okay.
for that gap client.
Okay.
Thank you.
All right. I'll turn it over to Mr.
So,
Cherry.
Madam,
I need a light system. I didn't see your hand.
I'm sorry. And I'm asking these questions because I'm trying to get something ready for y'all for your next agenda. So if you can help me understand, so far today you've talked about, on the slide, anticipated service expansion. Am I to understand that the anticipated service expansion is when the new Baker Act facility is in operation?
The building,
The building,
yes.
right,
Yes, the new building.
So, you've got here inpatient and residential. So if the inpatient is the acute care, those are the beds that would be dedicated to the Baker Act portion of the facility.
Mhm.
And so within the inpatient, Baker Act portion, how many beds are you gonna have in that Baker Act portion of the facility?
Yeah, Mr. Cherry's got that.
Okay, so
Yeah,
I'll
Mr.
write
Cherry will
that
cover
down.
that for you.
And so just, so a prelude, so I'm gonna need to know, if you can, how many beds are in the inpatient? How many are gonna be dedicated or guaranteed for adults? How many are gonna be guaranteed for children for Citrus County? And then also, how many beds are gonna be used for the residential in the new facility for the level 1 through 5? So
Yeah, he's going to
He's
cover
gonna-
that.
okay,
And as a
thank
matter
you.
of fact, it's very, very tiny, but there is a architect rendering.
I blew
You
it up
don't
as
have a
big as I
magnifying
could.
glass?
I blew it up as big as I could on my wall
Yeah.
TV at home, and I could not see it, so
Yeah, no,
I'm sorry.
we'll be glad to share that.
I appreciate it. Thank you. Thank
Share
you,
that
Madam
with you.
Chair.
Thank you.
All right,
Mr. Cherry?
Mr. Cherry.
So we've looked at the service continuum that we have and some of the things that we hope to have. I want to talk a little bit about the partnership and the process with funding, some of what you've already been talking about this morning. But our major funding source is the state of Florida. So in the state of Florida, the legislature determines what the appropriation will be for behavioral health services, mental health and substance abuse. Once they do that, and you know that process well, goes to the governor can line item any particular line that he wants, and sometimes he does. And then whatever the governor signs, that appropriation then goes to DCF. And DCF divides up that appropriation between the 7 managing entities in the state of Florida. So Lutheran is one of those managing entities, and they cover 23 counties to include our service area. So we contract with Lutheran Services for energy care services in Lake, Sumter, and Citrus counties, those 3 counties. The process, which you know it's difficult. It's tortuous at times because you basically, to get new monies into the behavioral health system in Florida, the legislature has basically said you have to go for a special member project. The legislature has not given us price level increases in 30 years for the core services that we provide. And it gets a little bit back to what you were talking about, Madam Chair. But no inflation increases because they don't want to hear the word inflation. So we don't say inflation. So we have to scurry around and find funding sources to cover that inflationary increase every year. And I like to tell folks say you've got a $60 million budget. Well, and say inflation was 5% a year. It was more than that this last year, 5%. I've got to find $3 million just to keep the same services we have today for next year. And this commission has been generous providing the local match. But imagine if every year I came to you and said, I need 8% more, 5% more, or whatever. Some years you can give that, some years you can't. But the biggest portion of the funding is from the state. And when you don't get those price level increases, it makes it difficult. So we go for special member projects. So the special member projects that we received this fiscal year, and I like to tell folks that, you know, we don't advocate any tax structure. Whatever the legislature determines is available. I just want to make sure that our areas that we serve get the maximum amount of those dollars possible. Because what Rick was saying before was that in Florida and in our area, we are at the bottom of the funding pyramid, that we receive less resources than other states get. In Florida, we receive less resources as a percentage based upon population than what is appropriated. So we fight for every penny that we can from the state. Special member appropriations this year that we received was 1.5 million for Citrus County, specifically Citrus County. It's what allowed us to create that access center that we have here. That access center was the first in the state to be a freestanding access center in a county outside of where the inpatient beds are. We fought for that. It took a year to get, not only did we have to bring along the county administration, we had to get DCF approval. And again, it took a year to get that. It was a no-brainer, but we did get it. And it was a first, and it's right here in Citrus County. It allows your police officers, your sheriff's department, to deliver folks to a local access center for folks to be reviewed and determine, do they really need to go to inpatient care? Before, folks, all law enforcement was delivering folks all the way to Ocala. And so you had all that time there, the processing, all that time back. So it was a fantastic thing that we were able to do to provide that local area. We only did it because your local delegation got the money into the appropriations bill. So 1.5 million is what funds that. The Lake County appropriation, and by the way, I think this will be our 4th year. That's the other thing about special member projects, is they're all non-recurring money. It's the legislature's way of making us come back every year for the same pot of money again. And it's never more, but if you're lucky, you get it appropriated again. And so 4th year coming up for that appropriation. 1.1 million to help with the low level of Baker Act funding for Lake and Sumter counties. So that is what that appropriation provides for, because our funding for Baker Act services, which is, it's all historic. I mean, these funding levels go back to 1980. And again, no increases. So few beds were being paid for by the state that we went for the special appropriation, the 1.1 million. This is the 9th year that has been approved. And so they understand that these services have to be provided. It's in the law that the state has to provide these services, but the way that they get them provided is they don't operate any Baker Act receiving facilities, except at the state hospital long-term care. But throughout Florida, they don't operate any of the acute care Baker Act receiving facilities, the chronic stabilization units, the psychiatric beds. No, what they do is every 2 years, they ask the world to say, do you want to be a Baker Act receiving facility? The whole world. And you can be a private receiving facility, which means you don't have to accept everyone, or you can be a public receiving facility, which means you've got to accept anyone from anywhere. A person from Mongolia is here in Citrus County, and they have a crisis, and they come to us. We got to serve them. We got to put them in that Baker Act unit if that's what they need. So every 2 years, the state does that. The only entity that has ever raised their hand and said, we will do that for you, is LifeStream. So we are the only public Baker Act receiving facility. In the 3 counties, there are no private receiving facilities. When Leesburg Regional decided they wanted to create a psychiatric hospital unit 5 years ago and created a 21-bed unit. And we told them there's no need for what you're saying there's the need for 21 beds. And so they struggled with a census of 5 and lasted 3-4 years. But even then, psychiatric hospital beds, they did not want to be a receiving facility. You got to ask yourself why. There are a lot of reasons, but no one wants to be a Baker Act receiving facility. It's our business. It's what we do. It's part of our mission. And so every 2 years we apply. We say we will be a public receiving facility. Not only our crisis stabilization units, but our hospital too. We are going to accept folks who are in psychiatric crisis. So it's what we do. And so we do receive funding for that. funding was not adequate. That's why we go for the special member projects. A year and a half ago, the state had a huge problem with forensic patients. As you probably know, forensic incompetent to proceed can only stay in a county jail 15 days before they are to be transferred to a state long-term hospital. Well, state evidently realized they had 500 individuals across the state of Florida that they weren't meeting that criteria. They weren't getting them out in 15 days. So they were breaking the law. So they put out the alarm that, will anybody provide residential facilities? And so we stepped forward and said, we will do everything we can. And we did. So we're working with them for residential facilities over in Lake County for that particular purpose. And again, we've been successful at it. We had won the bid. The legislature had put out 3 projects statewide 2-3 years ago. And Lutheran was chosen to have one of those projects for all 23 counties. We bid on it. We won the bid. And that unit is operational. So back to special member project, as a result of the state wanting people to create these beds, we put in for a special member project along with 2 other centers in Florida, one in Tallahassee, one in Tampa, to say we will each create a 16-bed unit. I've got a facility that I could renovate to provide those beds. So they appropriated $1.6 million each. In our case, we're going to renovate a facility that will provide 40 beds for that purpose. It's over in Eustis. So those are our current special member projects. For the year coming up, the legislature right now, we've requested the same $1.5 million for Citrus, $1.1 million for Lake Sumter. We are requesting that they provide now the operational funds for 16 of those beds where we're renovating that facility for them. And so we're requesting the 16-bed operational funds for that, again, in Eustis. We have another old academy that we can renovate for them for the same purpose. So the 3 of us have gone together again and said we can provide 16 more beds each.
What county is that?
Lake County.
So you have Marion, Citrus, Lake, and Sumter.
Our primary responsibilities are Lake, Citrus, and Sumter. We do have specialty programs in Marion County. No residential,
Okay.
It's all outpatient. So this year, again, the ongoing projects, the operating money for those 16 beds, they gave us the money to renovate a facility. We have told them we will renovate another facility if they provide capital outlay funds. And in Citrus County here, we've requested a $2 million appropriation towards the cost of constructing the Baker Wright facility. So those are our special member projects. As to Lutheran's financial statements, I can't speak to them. They are a huge statewide organization, so you'd have to ask them. But those financials don't surprise me, I will say that. They are a nonprofit. So in Florida, then.
May I ask one question?
Yes, ma'am.
Are you considered a Medicaid managed care facility?
No, Medicaid managed care organizations are basically HMOs and insurance companies. We contract with them to be paid for services if we provide them, if it's something they cover. Yes. So the state-local partnership, once Tallahassee appropriates dollars, there's the state law that requires counties to provide 25% match. So there is that partnership between the state, I say it's the state, the money goes to Lutheran and we contract with them, but the relationship is with DCF, who provides the funding, the county, and the provider organization. So we all have to work together. We lobby Lutheran every chance we get. If there are new dollars that come down from the legislature, again, we want to get our share of those. We have been very successful in writing grants specifically for services in Citrus County with SAMHSA, the federal agency that funds behavioral health services. And those are the projects that Rick talked about to bring in money in order to be able to provide more services. Because the service continuum, it is much more than what it was, but it's not what it needs to be. And so that every year we look at what do we think is missing in all of our catchment areas. And then we start planning on, well, where can we look to find resources to get that service implemented for the citizens of the respective county. So that's kind of an overview of, and the Baker Act receiving facilities are designated by DCF, as I indicated, licensed by ACA. So all inpatient facilities are licensed by ACA. You have to have that ACA license to open a facility. And so we'd have to go through that process, which is a fairly long process for a psychiatric hospital.
Madam Chair,
Yes.
I think what would be really extremely helpful is if you could give us a flow chart, because the way I understand it, this all starts at the Department of Children and Family Services. And from there, they subcontract, they work through
The managing entity
the managing entities, which there are 7, correct?
in the state, yes, for specified counties,
Right.
yes.
And then kind of break it down for us. I mean, there's a lot of acronyms that get thrown around about the funding mechanisms. Because when I go back and I've done my research here, and it, you know, ACA contracts with multiple Medicaid managed care plans.
They do.
But for the fiscal year 22-23, the legislature appropriated to ACA $25 billion.
Oh, yeah, it's a huge number.
So, I mean, you're somewhere in that, you're getting a portion of that, which I think would be helpful to know.
Way down the road, but yes. So that process, if I may,
Sure.
so every 5 years, the state bids out all of the managed care plans. So they have ACA do it. So ACA puts out a bid process, and whoever wants to provide services in their, it was 11 service districts. I think they may have reduced it to 9 in this last session. So this next go round, which the bid is to be put out any day now for the next cycle, which I think begins in early 2025, maybe it's October 2024. But so every insurance company in America is looking at, do we want to try and get this contract for Medicaid services? And so many of them will apply. They have to apply. Do they want every ACA region? All 9 of them, I think it is now. Do they want everyone? Do they only want to apply in region 1 and 9 or whatever they want? There are also different types of ACA plans. So there are 4 or 5 different plans that they can bid on one, they can bid on all 5. It's up to them. But they go through this extensive process every 5 years and then name the plans that won the bid in each region that ACA serves. So we are in ACA 3, it's called, which has been from here up to the Georgia border. Now, the legislature combined us with Jacksonville in the new structure. So that's the new region for ACA that will be bid on in this next cycle. And so they go through their process and ACA decides, okay, you get the bid for this area, you get the bid for this area, on down the line. And then there's a flurry of lawsuits because anybody who didn't get chosen sues the state. And that takes, 6 months, a year, whatever.
Of course they did.
Yeah.
Of course they did.
Yeah. And they finally work it all out. And then at that point, they say, okay, these are the people in your region who get the money to provide Medicaid services. So you're right, behavioral health is a little piece of that. But we have to then negotiate with each of those companies. In the old days, we negotiated with ACA. One contract, same contract statewide. It was better. So now we have to contract with, if they choose 6 companies, we've got to contract with each one of those separately for, could be a different set of services, different rates. Everything is different for each contract.
I appreciate what you're saying.
Yeah.
But that $25 billion
Yeah.
was specifically for behavioral health.
No, ma'am.
Yeah, it's right here. I got it.
Well, I can tell you that's not
So,
correct.
and then if I go on to read, and that's the reason I would like some breakdown, because like I said, there's a lot of acronyms. And this is all on behavioral health,
If you
just
could
for the state
provide
of
that to
Florida.
me, because the whole LACA budget is only 25 or 30 billion.
Then it says they received to data the Finance Committee of Florida Substance Abuse and Mental Health Commission showing that Medicaid expenditures on behavioral health services for children and adults totaled $10.2 billion in 21. But then it's a breakdown. You have the children's mental health, the children's substance abuse, and the adult substance abuse. And then DCF, the DCF Office of Substance Abuse and Mental Health receives funding for statewide behavioral health service for uninsured or underinsured, and that amount for 22-23 was $1.1 billion.
That sounds about right. Half of that is for the state psychiatric hospitals.
And the community-based care was $410.2 million for institutional care.
Okay.
Then they go on to provide that there is funding through federal block grants, other discretionary federal grants, state general revenue, the funds and the temporary assistance for needy families, and the program for eligible recipients.
Right.
Keeps going on with the federal grants. There's a lot of other information, the CMHSBG, the SAPTBG.
Right.
And then when it gets down to the managing entities, which you are one of,
Well, we're not. Lutheran is.
well, Lutheran is, but it goes to the MEs, the managing entities.
Right.
Most of the funding DCF receives for behavioral health services is passed through 7 private not-for-profit regional managing entities, which you are
ma'am.
one of.
We're not a
No,
managing
that's
entity.
Lutheran.
Well,
is.
Lutheran, but you get to, it goes down to you. Charged with administering a safety program net providing a coordinated system of care.
Right.
Florida law specifically prescribes over 20 essential components for this system, including, but not limited to, crisis stabilization, community interventions, case management, care coordination, outpatient services, residential services, hospital inpatient and aftercare, medication-assisted treatment, family therapy, therapeutic foster care, and MEs are currently serving 320,000 Floridians.
Okay.
And so for 21-22, the state budget, both federal and state revenue for MEs was $852 million.
Okay.
So for me, I think what would be very helpful, and then you get onto all the other state agencies, the Department of Education, Corrections, Juvenile Justice, Judiciary, the Department of Veterans Affairs. If you could break down and tell us exactly your funding, where it comes, how it gets dispersed down, and so that we can, because what I guess I'm finding, and I'm not disputing whether we need a Baker Act. What I find in our community is that we're very disjointed. We have a lot of passionate people. There's a lot going on, but I think everybody is working in silos. Nobody really knows what the left hand and the right hand are doing. And I think, I've been charged to chair the Public Safety Committee, which to me encompasses all of this. And really what I would like to do as the chair of that board is I would like to create a symposium and bring all of our people to the table that are passionate and interested about really getting to the bottom of our mental health in the state of Florida. Obviously, we're putting a lot of money towards it, but we rank 48th.
Right. Well,
And
that's an indication of the low amount of funding in Florida.
Well, I don't know. I don't know if it's
is.
a low amount of funding. But I mean, obviously, money doesn't fix all the problems. And all I'm suggesting is I am not, and again, I think our chairman said it best, I am not disputing the fact that a Baker Act, but what I really want to do, I think our governor's wife, Casey DeSantis, is very passionate about this.
Yes, she is.
And I think we, as a community, as Citrus County, we need to get to the table and we need to identify all of our partners and how we're going to best provide the mental health and the substance abuse treatments that we can to our citizens. Hopefully we'll be a model for the rest of the state, but that's what I'm asking for. I think it's long overdue that we need to get into these components of what's being delivered in our community and who's providing those services.
We'd be glad to be a participant in
Please,
that process.
please. Okay, are you done?
Yes, ma'am, for now.
And
Okay.
I think she's touched on something that I have been saying. When I was the chair of the Public Safety Committee, I couldn't get Lutheran Service to give me any metrics. I know our past administrator tried very hard. He really pushed to try to get metrics. And what I'm seeing is you're almost at the bottom of the pyramid, and there's a lot of money up here. And you said that they cover 23 counties, but there's 67 counties in the state of Florida. There should be, what, nine counties per entity, 7 entities?
Well, there's 7 entities.
Yeah.
The state prescribes what the districts are.
But this is really weighed down with 23. So if another entity, one of the 7, has only 9 counties, that county's getting a tremendous amount of money. Where we are having whatever piece of the pie it is from Lutheran Services, because I've never been able to get that, is divided by 23 counties. And you're only doing
We're
3.
3 of those 23, correct.
See what I'm saying? That's what I'm trying to get at with the money. And it's not clear, it's not transparent. And in order for us to be fiscally responsible for our tax dollars, I need to know those numbers, those metrics. And I think you've done a pretty good job for me, but we would need some more, because just going down the list, Medicare, Medicaid, private, non-paid, Lutheran Services, LifeStream Foundation, special member projects, the state. We haven't even touched on federal dollars.
Right. The federal dollars are a small percentage, but yes.
But we don't know. I don't know any of that.
No.
And that's what I would like
Well,
to get from you.
We've told you today what our federal grants are.
Well, I heard 4.5 million. That was the state. I didn't hear federal.
No, but Rick mentioned the projects that we have gotten funded. It's a grant-making process.
Okay, he
So-
said grants, but I didn't
Yeah.
hear an actual amount.
Yeah.
But you see where we're at, how much is it going to be for Citrus County? How much do you really need? You get the 1.5 million from the special projects. We give you, pay another $1 million. That's all run through Lutheran Services. And then there's private, Medicaid, Medicare, and non-payment. So I think that would help us to know where we stand and what we need
Right.
in our county.
We can provide you more information if
Thank
you'd like.
you.
Certainly.
And in addition, just the breakdown for the people that you're serving. From, how many, Debbie Savage is here, and I spent a couple hours with them last week. They're very passionate about
Yes.
the folks with dementia or Alzheimer's,
Absolutely.
and frankly, you'll never convince me that, Baker acting somebody with that condition is the appropriate measure. I have my mother-in-law who has dementia, and it's
My mother did also.
it's sad. I have 2 family members of my own biologically that have died from dementia. They're confused to begin with. So to take them and put them in a facility, especially in the general population of other adults, is just incomprehensible in my opinion. So
Well,
that's another component of part of why I think this symposium is needed. I have been told, I have not verified it, but we've lost over 100 beds for memory care in this county. I'd like to know why. I would like to know, I was also told that some of our providers of this care for in the memory centers are some of the people that are doing the Baker acting of these people. And if that's the case, and that's why they're there, that's not acceptable.
Yeah.
So
Well-
there's a lot of work that needs to be done.
there's
I
always-
appreciate what you do, but I would like a very detailed breakdown of children, if it's strictly mental ill, in every category. If it's mental health issues, if it's drug related, because we need to be able to address this in our jail system as well. We need to, we need to know why these people are in jail and how, if they come out, how do we make them a productive citizen of society? We can't just put them in jail and then expect them to come out and not give them the tools to be back in society, because that's why they end up with the mental illness and the drugs. So again, I'm beating up on this situation, but the more information that you can give us, how you're getting paid, where it's coming from, because I have to be able to have those tools to know what the other entities across this county, what services are they being delivered? How are they being funded? Because if we don't find how we are coordinating and managing this from the top down, we're never going to get to the bottom of it. It's just going to be every person for themselves. And if we really, this is the time. I mean, I'm so thankful that Casey DeSantis really wants to get to the bottom of this, and I am very passionate about this. I intend to find some solutions and have some partnerships and work throughout our county. So the more information you can provide me, the better it will be.
That's what we're all about, and we will try and provide you the information you're looking for. Speaking of folks going into the Baker Act unit, our philosophy is that we want to provide care in the least restrictive setting that a person can function in. You know, if I had my way and I could cure everyone, I would not have an inpatient psychiatric facility. Other people can say that about other diseases, that, you know, if the world were perfect, it would be great if we didn't have to send people to a hospital for a heart attack. You know, how can we cure that? Well, we will work, and we're trying to create a better system of care. And again, we'll try and provide you with all the information that we can so that you can take that into consideration for the entire system of care that's needed. With folks with Alzheimer's, we all agree that if we can keep them out of a psychiatric hospital, we would want to. But unfortunately, they do come to us under the Baker Act, and we have to deal with it. So we're going to talk about here in a little bit. There will be a specialized 10-bed unit for geriatric, which most of the dementia patients fit under, to help with them not being in the general population.
Chair,
Yes.
I apologize.
No.
I
Go
wanted
ahead.
to catch him before we got off this slide. I heard you to say you've gotten 1.5 million request, a 1.1 million request, 16 beds for the facility you rehabbed in Eustis, and then there was another 16 beds. Where are those 16 beds that you're asking for that appropriation? Is that the 16 beds in
Leesburg.
Lecanto?
No, ma'am.
Okay.
Leesburg.
Right, thank you.
Yes.
I'm just concerned, and this is one of many questions that I will dig deeper into. That's why I wanted this workshop.
Yes.
Is I have always been concerned that 10 beds for dementia and Alzheimer's patients is not enough, especially between Hernando and Citrus. That has been one of my hangups.
Right. You mentioned the memory care and the loss of beds. You know, I did not realize that. It's not what we do. Those are specialized units. I suspect it has something to do with finances, why those beds went away. And I assume they're operated by hospitals, but I don't know.
Yeah.
But those are more appropriate places for a person with dementia to be.
Well, and we'll discuss this further, you and I, but, you know, I took care of my mother, 87, and I had my husband and 2 daughters to help, and it was god awful at times, and she was the best mother ever.
Exactly.
And it was still horrific and challenging, and I can't imagine being a spouse, an 85-year-old spouse, trying to take care of that. So the stress that is happening on people, and that's why I keep coming back to, is Baker Act facility what we really need in Citrus County? I know we do, but
Yes.
I'm very concerned about our elderly and what they're going through in the Baker Act facility. So we'll dig deeper into this. This is, again, why I wanted this workshop. Because there's more questions than answers for me.
There are a
And-
lot of questions.
Yeah.
Yes. The next slide. Maybe the slide before. Let's see. Should be YN Inpatient Baker Act Receiving Facility. Is that back one more?
No, it's the one after. There you go.
One after?
Yep. You got it
Okay.
now.
All right. Well, I think we all know why we need a Baker Act Receiving Facility here in Citrus County. There is the need, and the need is growing for receiving facilities. Whether we like that or not, it is growing. Law enforcement deals with this issue every day, and the majority of the Baker Acts are brought to us by law enforcement. So we are part of the public safety system. We are part of the healthcare system. We provide social services after a person happens to be in the Baker Act system. We do everything that we can to help the individuals. So distance is one of the main reasons. You could have people, they're having to travel to get to the receiving facility here in Citrus County, and then we're having to transport them over to Leesburg. Not an ideal situation. It's the best that we can do right now. We need a facility in Citrus County that can serve Citrus County residents. ACA says that a person shouldn't have to travel more than 30 minutes to get to a medical service. Well, they don't meet that in a lot of instances, but we definitely aren't meeting it with the need for the psychiatric facility local here so that people aren't having to travel more than 30 minutes. The lack of psychiatric practitioners, I know you've talked about this. When we came to the county, I think there were 2 psychiatrists. And it is a dearth area as far as mental health professionals. That's what we inherited. We are trying to bring in more mental health professionals. My understanding now is there's 1 community psychiatrist. The other psychiatrist has gone over to the VA center. And I assume he's providing services in Tampa, I'm not sure. But this facility will bring 3 psychiatric providers to Citrus County. So we will have a psychiatrist available as part of the hospital and hopefully doing some outpatient services. Also, we'll have children and adults covered along with geriatric. Again, it will be 3 new psychiatric providers of care, psychiatrists, APRNs. At least one of those will be a psychiatrist, hopefully 2. And so that will be part of what the receiving facility brings to the county. And then we all know the best health care is local health care. I mean, imagine if you had to travel 50 miles to a dental appointment, there and back, 50 miles to get your eyes checked. It's just, it's not what it should be. And so this would take care of that as far as individuals needing inpatient psychiatric care.
Ma'am.
So, did somebody?
I wanted to
Commissioner
ask-
Bays.
Is this going to be, I'm a little bit confused. Is this going to be something more than a Baker Act facility?
I'll go ahead and get to that right now if you'd like. We would like to build 60 beds. There's the need now for 40 beds in basically 10-bed units. We have to be able to flex our units because we'll have 10 beds for children, but any given night, they're going to be between 11 and 20 kids. And so we have to be able to flex our units, use one of the other units for kids if that happens. We go to that 11th kid, it's got to be in a separate unit, completely separate from adults. With the geriatric population, we're going to have a 10-bed unit. But if it goes over that, then we've got to figure out what to do. And so our intent is average, 10 kids, and this is for Citrus and Hernando. 10 kids, 10 geriatrics, and 20 adults. That's what we see the need for right now. So we want 40 beds to be inpatient to start, and the other 20 beds to be one of those step-down facilities, because right now there's no capability in this county for any step-down out for folks who need more care, don't need to be back in the community yet, but they're not under a Baker Act. So that's what we would like to do.
Can you describe exactly what services would be delivered in a step-down bed and where are those currently? And those services
Well,
being
the only step-down beds we have now are in Lake County.
Lake?
Yes, ma'am. Yes, ma'am.
And exactly what services do you give under a step-down bed?
Well, that's that residential level 1 that Mr. Hankey was talking about.
But I
So-
thought that was level 1. I thought this would be like level 2, a step-down.
No, this is a step down from inpatient psychiatric level 1. And we would only operate those 20 beds as step down. My view is we need to build for the future. And the future, 20 years from now, you're going to need 60 beds. This county is growing fast. The whole area is growing fast. And unfortunately, the need is going to increase. Even if it stayed the same per capita, there's going to be a need for 60 beds in 20 years. And so as more inpatient beds are needed, we would have to find a different facility for the step down that we want to implement now to cover current needs.
But some of the outpatient services that you're identifying, you're currently offering those here now?
Some of those we are. We would anticipate that those would increase, that would have more capacity.
Are there any on this list as you identify it that are not being offered here now in Citrus County?
We don't have an on-site pharmacy, the medication management, medication assisted, case management, peer support. They are being provided, but not at the levels, the number of folks that are needed. So they would be enhanced. And they would be on the one campus is one of the main points.
But you do receive money currently to deliver these services to Citrus County residents?
At the level that we're funded, yes, we do.
Okay.
And we would like to increase that.
When you and I met last week, you indicated it would be a 30-bed facility, with 10 being for the Alzheimer's, and then you told me 20 beds would be flex between adult and children.
Not Alzheimer's, but geriatric patients. And hopefully the Alzheimer's will be a small portion of that. But yes, in looking at what is needed, it is the 30 beds for adults and children that are able to flex at any given time.
And then what exactly is the relationship with Hernando County? Because I'm confused. I mean, what is it that you're agreeing to provide Hernando County
When
with?
Hernando County heard that there was the possibility of receiving a facility here, they indicated that they would like for their children to be served in this facility. So my understanding is that their main aim is to assure that their children are served, because they're going all over the state now, evidently, because of the dearth of beds. And so this would give them a local resource, and that is their interest. I would assume that we will get some of the adults also if it's the closest receiving facility. So I see the facility serving Citrus and Hernando counties.
Anything else, Commissioner Bays?
Not at the moment.
Okay, I think we're getting to the end of our time, but I'm just gonna
Okay.
ask one more question and let the rest of the commissioners ask a question if they have it. Of this 40,000 square foot facility, how much is the Baker Act?
With the Baker Act would be the inpatient beds. So
But I
what
mean
we're
square
envisioning
footage,
is 40, so two-thirds.
40
Two-thirds.
beds,
Two-thirds of the 40,000 square feet, 27,000 square feet, until we need the other space for inpatient. We're designing it and building it so that we are designing for growth.
okay.
So 20 years from now.
So more
I
than
envision-
half is a Baker Act facility.
Yes, ma'am.
Okay, I'll do my square footage, figure that out.
Okay.
Chair?
So,
Yes.
oh,
Might I?
I'm sorry.
Yes.
I'm sorry. So we talked earlier about the 16 beds, level 1 that was going to be in Lecanto at the renovated. And now we're talking about 20 step down planning for the future.
Right.
Do you intend to keep those 16 level 1 in Lecanto, or
We
are
do.
those going to be incorporated into the 20?
No, ma'am. It will be an additional 20 beds.
So we're going to have 36 step down beds located in Citrus County.
Hopefully. Yes, that's the plan. And of course, again, for the 20 beds, it requires this god-awful process of finding someone to fund it. Obvious person is DCF, the legislature, and we will have to lobby them and figure out how to get the funding in order to put a program in there.
And that's part of still trying to find the 5 million to fund the 30-bed unit in general? Or have you identified where that 5 million is coming from?
That would be, well, those 30 beds will be the inpatient. Yeah.
Right, have you
I just-
identified a funding source for that 5 million operating?
Yes, yes.
What's that funding source?
It would be the state and the local funds. So the state dollars that we already have, we would have to continue getting that 1.5 million. Hopefully, we can get it into the other pot of money where you don't have to go back every year to get it appropriated.
Might I?
Yes.
And so when we're talking about that 5 million, now, I know last year we had the match funding that was, we regularly paid $400,000 or $500,000, and then you got the appropriation, and then our match went up to like 900 and
Chair,
Right.
is this stuff that we need for the contract that's coming on 28?
that. Yes, sir. That's why I'm trying to work on that.
All right, just making sure.
Go ahead.
So, so it went up to the 1 million. So is the 5 million, if you get the matches for those, or then is our match gonna also include that extra 5 million?
No, for
Okay.
the cost to operate this, we already have, we'll be moving money that we're now using in Leesburg to pay for these beds. Move those funds here. So no increase unless we get more funding later on.
Okay, so we're still looking at about that 1 million.
Yes, ma'am.
Thank you.
9, whatever it is. Yes, ma'am.
Thank you. Mr. Cherry, can you finish up your, and
Okay,
then we'll.
I will. Why don't we, I was going to, on the funding and accountability screen, I was going to just give you an overview of the 59 million total that is received by LifeStream, our total budget, basically. So we had said the funding streams, local governments, which are school boards and counties, about $6 million, LifeStream wide. State general revenues, about 28 million. Private grants, about 5 million. That includes 4 million in kind that we receive from the pharmaceutical companies. Patient fees, about 15 million, state and federal, 5 million. So what I hear you saying is you want us to give you the breakdown for Citrus County services specifically, and we will go back and do that.
Thank you.
Then the anticipated cost of the facility, the 40,000 square feet. Just wanted to go to the anticipated sources of funding. Citrus County, 2 million. Hernando County has indicated 2 million. We are requesting from the state of Florida 2 million. And as you know, we had that approved last year in the supplemental House and Senate. And it was, again, a 6-month process of getting them to approve that. We were one of 217 projects out of 3,000 that got approved. And then the governor did not follow through and tell them to spend the money. So we're going back and trying to get a 2 million appropriation towards the construction. Citrus Hospital Foundation is a question mark. I don't know at this point. And then LifeStream will fund the remainder with cash, and we will do tax-exempt bonds for that. The facility layout, it is laid out in 3 20-bed units. Each 20-bed unit is bisected into 2 10-bed units so that, again, we can flex as needed. And we'll get you a bigger copy if you want. This is just preliminary. But this is the result. This is a result of working with architects for 6 months and $50,000 boiled down to that. And then finally, one campus, we will still have subsidiary offices because I believe that we need to. They're here in Inverness, we have the children's office, and those are the folks. We implemented, I think it was 7 new positions that we contract with the school board to help us with, but master's level physicians that you didn't have before. They're in the school system trying to identify kids at the earliest possible time and helping them to get back on track and hopefully not having to access the system further later. So that's it other than questions.
Thank you. Commissioner Finnegan.
Thank you for the presentation, Mr. Cherry. Thank you, Mr. Hanky. Much appreciated for your time and your education today.
Thank you. Yeah, I add my thanks. I followed everything brilliantly until we got in the weeds on step-down beds versus Baker Act at the very end. This is crying out for a really good flow chart on where we are now and where we want to go.
Okay, flow chart.
Just,
Yeah,
it got a little muddy there at the end, but,
okay. We
Thank
can
you for
follow up
coming.
if you'd like.
okay.
Thank you. Commissioner Kennard.
Yeah, I'll just echo the thanks for being here and the presentation, and I love the schedule of events. I'll look forward to seeing it open up.
Commissioner Bays.
I'm good. Thank you very much.
Thank you. I know this was, it wasn't easy, but it is, it's easy for you. You do this every day, but it's not easy for all of us. And it's not easy for the public to understand. There's been a lot of back and forth and misinformation, and I thought this was the best way to handle it.
And we appreciate it. Thank you.
Thank you.
Anytime.
Thank you. At this time, I'm going to open to the public. If you would like to speak, you have 3 minutes. Would ask you to fill out a card and a green card and state your name and where you live, and give your card to the clerk, please. First speaker, please.
Thank you, Commissioners. Pleasure to see you all. Thank you for doing this. Mr. Hanky, Mr. Cherry, thank you very much. Susan Lake, can't thank you enough. I am Cindy Fine. I am the Executive Director for the National Alliance on Mental Illness here in Citrus County. And we are very, very interested in this and have currently really been working closely. I've spoken multiple times to Mr. Hanky, and he's gotten me hooked up with some good correlation, working on a very strong partnership, which there hasn't been in the past, partly on NAMI's fault because we didn't really have an effective ongoing NAMI. We do now. So I want to continue that partnership, deepen that partnership. Commissioner Schleba, as you talked about the young women in particular, NAMI Citrus is starting a group for 13 to 17-year-olds. NAMI National serves 18 and up. However, we can provide them an arena for talking. And so I will be talking to you about that, how we can get those young women and men involved in that. Moving forward, I would like to ask again, please have NAMI at the table. You know, you talked about...
Please direct your
Oh, I'm
comments.
sorry. Thank you. They talked about stakeholders with LifeStream, and I would like to make sure that they do continue to include NAMI as a stakeholder because this is very near and dear to our hearts.
Yeah.
They are experts on that health side. I have the people who have the stories, who are living the nightmare that mental illness causes. I love the idea of a complex. I think this is something that we've talked about on our own, lots of us, of having a campus that is all-inclusive. I would like to say, as you make your plans going forward and approve things, one of the things that is very, very important to our NAMI members is a facility for, an assisted living facility, I guess you would say, for their children who have serious mental illness. I'll tell you, one of our members just passed recently. She leaves 2 sons, both with severe schizophrenia, and the only other living family member is a daughter up north. So her concern has always been, and continues for us now, what happens to these 2 young men who can live, but they really need assistance. So if that can be added at some point to truly make it a totally comprehensive campus, we would love to see that. And I would just like to thank you all for addressing the matter.
Thank you. Next speaker, please.
Hello. I looked into my solutions. They didn't work out
I
so
need,
well.
I need
Anyhow,
your name
yes,
and where you
thank
live.
you. Gail Romiti, and I prepared a statement. You can see the EMF just coursing through, and I'm nervous, but coursing through my body here. Mental health is a serious issue, largely caused by a lack of nurturing the nature of mankind. Today's surveillance of humans is mostly wireless. This surveillance invades our schools, county buildings, retail stores, and is in this courtroom. The waveforms are tracking me and causing me great discomfort. Historically, mental health professionals use shock treatment by attaching diodes by wires to the skin to recondition defectors. In 1964, Manhattan Bail Project put ankle bracelets on prisoners as a condition for bail. Look into the 1969 bipartisan political committee concerned that Americans were turning away from controls of the church. Now, unelected bureaucrats have infiltrated policies of Health and Human Services. LifeStream Center gets federal and foreign dollars and is staffed by traitors to the U.S. Constitution and American prosperity. When I submitted a complaint to Florida's Medical Professionals Association about fraud committed by medical professionals at Langley Health and LifeStream Science Center to be informed, Florida has no penalty available for doctors who commit fraud in the state of Florida. Why is Lutheran Services entrusted with hiring LifeStream Behavioral Center? God is good, but I thought church and state had been severed. Of course, I've been a stupid American by surreptitious political design of mis- and disinformation. We need equal opportunities in education. History will prove LifeStream Behavioral Center has been used to intimidate political prisoners and truth tellers for a class of global technocrats coming for your personal freedoms. If you do not wake up and become informed, you will be eating bugs in the World Economic Forum's Design 15 Minute Cities and like it. Shocked to learn queerness is a waveform frequency, and it has been said that 528 hertz killed John Lennon. RFD human research subjects and development of direct energy weapons is the true Epstein story behind human trafficking. Thank you for your attention.
Thank you. Next speaker, please.
I gotta get out of here.
Next speaker.
My name is Nancy Proffer, and I am the mother and guardian of a 38-year-old young man with schizophrenia. I live in Citrus County, and I have for 5 years. He has been Baker acted 8 times since he's been 18. Once in Leesburg, and I took him to the hospital here. And I will have you know that Citrus County Memorial Hospital was the most professional that I have encountered. It is difficult for us because we have to travel to Leesburg once a month for his injection because there is no psychiatrist to see him in Citrus County, and I would really like to see that happen here. It does concern me that when my husband
Please
and I
please
pass-
direct your comments to the
It does
chair.
concern me when my husband and I pass that I don't know what'll happen to him. Just like the lady said with, the lady that had 2 young men. I don't want to cry. Anyway, this is a very important facility. There are people who really need it for mental health issues here. And a lot, from what I've seen over the years, the last 20 years with my son, a lot of the people who self-medicate with alcohol and drugs may actually be people who have mental issues, who need medication. Mental illness of my son's type is actually a physical thing. And it has taken me years to explain that to him, that it's very much like diabetes or any other physical condition, that it requires this chemical to help your body to function correctly. And so it is very important that we as a county help to correct the stigma that surrounds this. So this is a very important facility. And I appreciate you guys working on it. Thank you.
Nancy, thank you for your story. Next speaker, please.
Hello, my name is Jessica Rittock. I live here in Inverness, and I am the parent of an adult son with severe mental disability. This facility is important not only for the Baker Act beds it provides. Obviously, not having to make that trip to Leesburg every time would be a benefit to the sheriffs and to the family. My son has been Baker Acted 3 times within the last year. Once, Leesburg facility was so full that he had to be taken to Tampa to be placed in a crisis intervention unit. And he did remain there for several weeks. So, you know, having to have that distance between the two of us with everything that you're trying to accomplish for them, it makes a difficult situation even that much more difficult. He was released and his follow-up appointment was in Claremont. There was no way I could get him there in the 2 days that we were given to have that appointment. So that follow-up care was in the wind until I could contact LifeStream on a local basis and make an additional appointment, which took me, no lie, 5 days of phone calls and 3 or 4 return phone calls with different people in the agency before I was finally able to book him an appointment in Leesburg, still almost an hour away. So having not only the Baker Act beds, but the aftercare and the medication maintenance programs and the counseling. When we called to schedule an appointment for counseling, we were told literally, this was the fall, and we were told literally, you will hear from us in the spring. That was the soonest they could do. Now, I'm not faulting LifeStreams at all. As we heard, they're the only one raising their hands to provide these services. Numbers, population's increasing every day. We're getting more and more people here in the county. We need the services, not just the Baker Act beds, but all the additional things that go with it. It seems, and no disrespect intended, if you have not lived through the experience, you don't have the experience. Some of the board members are really unfamiliar with the experiences that patients and families are going through trying to get these services. Psychiatrists, we heard there's none here. What are you supposed to do about that? As a patient, as a caregiver, what are you supposed to do about that? You spend hours and hours and hours on the phone, on the computer, looking for resources. You call DCF. DCF refers you to LifeStream. You say, well, I've already spoken to them. You call LifeStream and the counselor, your case manager. Well, she was fired 2 weeks ago. We haven't been able to replace her position yet. These are all real life difficulties
Thank you.
that we encounter. Thank you, guys. I appreciate it. I hope we go forward with the symposium. Please include NAMI at the table. Thank you, guys.
Thank you. Next speaker, please.
Good afternoon. Lieutenant Craig Callahan with the Citrus County Sheriff's Office Community Impact Section. I manage the behavioral health unit where I have 2 detectives that are assigned to that unit and follow up with a series of things, but behavioral health or mental health is absolutely at the forefront of what they do. In addition to 2 substance abuse advocates as well. So I couldn't agree more with what the 2 women said before me. I think they hit the nail right on the head with the lack of services here and the issues that we've had. So I just kind of wanted to highlight some of the things that the Sheriff's Office experiences and my unit in particular. So those things would be the calls for service that we deal with at LifeStream at the facility, some of the transportation issues, and then the follow-up care as well. So like Mr. Hankey had mentioned, in 2020, 1,742 went to LifeStream Access Center in Beverly Hills. 1,433 of those were brought there by the Sheriff's Office that year. So 1,111 for Baker Acts and 332 Marchman Acts. So on average, about 4 a day for the Sheriff's Office. So we definitely touch or have a lot to do with transportation, Baker Acts, and getting them to the facility. So just some quick stats that I wanted to go over. As far as calls for service for 2022 to today, year to date, we've had 23 calls for service at the facility. 4 of those were for escapes, okay, and within an eight-month time frame. So either at the facility or during transportation to Leesburg. So my point there with that is the Access Center, although it does, fill the gap or has assisted with not having to take them out of county, there definitely are some issues with security that we've seen and getting those individuals where they need to go in Leesburg. So I'm not here to advocate for LifeStream or any other organization. I'm here to just tell you that we are in dire need of a facility here. We certainly could use that, and additionally the resources. So like the woman said before me, there are no psychiatrists here. I think we only have 4 in the county, and that's a major problem that we see is the follow-up, getting people to those appointments, bringing somebody to Leesburg or getting those individuals to Leesburg to get those follow-up services. We have multiple complaints from our clients that we deal with regarding that. And getting the follow-up care, getting to appointments. The telehealth is an option, obviously, but I believe there are some constraints with that, with getting medication to the patients. And I've just got story after story that I could cover regarding that. So that's our position on that we really do need that facility in our county to provide those wraparound services.
Thank you, sir.
Thank you.
Next speaker, please. Next speaker.
Morning, my name's Brad Benson. I'm from Hernando County. Our board is, I would just say from seeing you all a couple times, our board is much less competent, but we'll leave it at that. We have some people in Hernando County that believe that the way to handle these situations is to drug these kids and get them off the street. We have a useless school board. They Baker Act 40 to 45 kids a month in Hernando County. That's an awful lot of kids. And psychiatry, I grew up in a military family, and oftentimes military families were used for the MK Ultra program. And my mom was a very smart lady and went away one night to the officers club in England and came back talking to TV sets. And then they put her in RAF Lakenheath, and they gave her 13 shock treatments. And then we got air evac'd out of England back to Walter Reed, where they did the same damn thing. And, drugging is not the answer. Psychiatrists don't do anything but prescribe drugs anymore. Most of the work that used to be done by psychiatrists who are medical doctors is now done by psychologists. We had the gentleman say that 99.5% of their complaints are resolved by the oversight agencies. Now, I also happen to be a former federal government employee and whistleblower and went through 8 years of many oversight agencies not doing the proper oversight. I ended up having to go to federal district court, and I'm one of 1% of U.S. federal government whistleblowers that came through this system that's supposed to have oversight and protection. It's just too easy to Baker Act these kids. Finally, Hernando County believes that this new facility is going to be located somewhere near the border. And I would also say that I would like to know how this deal was made with Hernando County. I don't think myself or my colleague Diane have missed a Hernando County board meeting in a year and a half, much to their chagrin. And I've never heard them talk about it until we brought it up last week. And they said, oh, well, we talked about this and we've already committed $2 million. How? And they also said that, well, if it's not near the border, they don't see any reason to commit the $2 million. So I think we're going to go back and report that it's obviously not near the border. So thank you
sir.
very much.
Thank you. Next speaker, please.
Good afternoon, Diane Liptak, Hernando County. As Brad said, we have attended everything. I don't think we've missed more than one or two over the last year and a half, and none of this was ever mentioned. And they did a fine job of not answering any of our questions or responding to our comments from last meeting about this subject. And the way I see it, this is really an extremely slippery slope, what you're doing. Very slippery. We need mental health help, but between incarceration and voluntary and involuntary is a very slippery slope. It can be any one of us that ends up in there. All we have to do is disagree with the wrong person and something can happen. And there's no way to get you out. You know, and by the time they finish drugging you, and what is the drugging system? When does it stop? How long do our kids get stuck in here? How long can it go on for? My nephew in California works with these kids. He's a psychologist. He works with the kids in California that nobody can touch. They can't reach them. They would just as soon stab you as talk to you. Stab you as eat. They don't care. And he said he considers it a great day when he gets any kind of positive response from one of the children that he's dealing with. And some of those kids have been in there for a decade and longer. So where do you draw the lines? No, I mean, it's not just stuff. I mean, look at the faces on that poster outside the door of all those little kids. Those little kids, those cute kids, are what you're looking to put away one day. And who's going to stand up for them? I mean, we've got the doctors making money, we've got the LifeStream making money, and everybody in there making money. You know they're not in this for nothing. There's a lot of money in this pot, no matter how much, you know, whether we're at 48th on the list or not. There's a ton of money in this. And 450 kids turns out to be something like 36,000 kids for the state. That's crazy. There are not that many crazy kids in the state. Yes, there are kids who need help, but they're not all crazy. And I'd like to know what kind of oversight is this facility going to have to provide for us? There needs to be regular facility oversight, the care oversight, the kids oversight. There has to be somebody who can go in and say, why is this kid sitting here in clothes that obviously don't belong to him? And why are they filthy? Why are they sitting in filth? Why haven't they got any shoes on? Why haven't they eaten? Why have they lost weight since they've been here? Why is their hair not clean? Why have these kids never brushed their teeth since they've been here? There's got to be a lot of other things.
Thank you.
Thank you.
Next speaker, please.
Good afternoon, Sabrina Watson, Lecanto, Florida. I'll be speaking for the Exceptional Life Project, so I'll take my 5 minutes, please. I just want to talk about the Baker Act. Factors that customers consider when making a purchase, because that's what this is. It's a purchase of a facility to be used for a service for the county, a service the county is already paying for. One of the first things most people consider is whether or not the product meets their needs. What are the needs in this case? Is it the need for mental health care or the need to get a problem off the street? Let's talk about product functionality. Anyone, and I do mean anyone, can be Baker Acted. Loony bins, as they were commonly called, have been used for centuries for all kinds of reasons. They've been used to silence critics, steal people's assets, hide crimes, and commit quiet and legal murder. Interestingly enough, this facility also qualifies for the Florida Free Kill Law. If you have no children under the age of 25 and no spouse, and you should happen to be murdered either accidentally or intentionally while in this facility, your family has no recourse, any of them. Ease of use. Just about every person in this room would qualify at some pivotal moment in their life. So the police swoop in and some uneducated officer makes a decision to harness a human being, pull them off to a facility where they can be forcibly incarcerated and drugged against their will for an extremely short period of time and then kicked onto the street with no follow-up care. Price, well, let's see. The first thing you do is get a secret backdoor meeting. You find an AMA shill to encourage others that this is a great plan. Lie to the potential partners about what it is and what it isn't. And when it's done, it really won't matter, right? And then pawn the plan off on the uneducated taxpayers. Backdoor meetings that include local commissioners and people of Hernando County, but not the Citrus County administrator. Tell Hernando County or let them believe this is a dedicated children's facility. That's what they told their constituents anyway. Round up a lobbyist that gets paid on both sides of this deal because he represents both LifeStream and the Citrus County BOCC. Nothing to see here, folks, except a little conflict of interest. But what's a conflict of interest among friends, right? Promise $2 million of the taxpayers' money to help a business that specializes in caging and drugging people against their will. Now, that part is a problem. It is illegal for the county to give taxpayer dollars to a business without a contract for services. We will already have a contract for services with this organization, unless, of course, you can instruct the county attorney to find a way to write some kind of contract that fits the bill. In some court cases, they call that money laundering. It may be considered malfeasance at the very least by commissioners in both counties. Oh, and did I mention that once you step into the illegal realm, elected officials lose their immunity? Who knows? Someone may test that. Next, see if you can get the hospital board to pony up a big chunk also of the money that one commissioner claims rightfully belongs to the county anyway. Sneak an agenda item onto a board meeting that violates the Sunshine Act and force a vote. Now, we know some people were in on the sneak because the hospital board attorney showed up to clear the air, but the public wasn't notified. Then there's the problem of who owns the building the taxpayers would be chipping in on. LifeStream's property and the taxpayers help pay for it. But it really will be okay because when LifeStream is no longer the provider, they are happy to sell or lease the building back to the very people that paid for it. Quality. This organization does not provide these services because they care about people. They provide them for money. $60 million and counting. Now that's some money. Then there's the clear issue of their track record. Dozens of filed complaints that include rape and death of people, can't call them patients, in their custody, can't call it care. It does not meet the criteria for either. Don't forget the problem of metrics. Interestingly enough, there aren't any. Nope, no numbers of how many men, women, or children have been locked up in their facility for any given time, cited as proprietary business information by one commissioner. Anyone see a pattern yet? Variety and choice. There is no variety or choice of companies in this field. Now, a commissioner in Hernando County said that was because there was no money in it. 60 million sounds like money to me, and a lot of it. So, does a Baker Act facility meet the threshold for satisfying the need for mental health care? Nope, zip, zero, nada, not at all, because it's not mental health care. Does it satisfy the need for getting a problem off the street? Well, yes, it does. It checks every single box. What we have here, folks, is a choice regarding the future of health care in our county, a choice about the types of deals we make as a county. We do have some very capable and intelligent people on this board, and it's time for them to step up, and I think I heard some stepping up. So thank you.
Thank you. Is there any other public? Thank you. Please step forward. I have 3 minutes to speak.
Hello. My name is Marilyn. I am a NAMI member, but more importantly, I am a mother to a brilliant, beautiful daughter, college educated, who was hit with a mental illness of schizophrenia, who is unable to get a job and keep it, who is not recognizing that she has an illness. She does not take medication because she doesn't believe that she has a problem. She was Baker acted once before. In the other state that we lived in, she was hospitalized a few times. But it seems like everywhere we go, it seems to be the same thing. There's not enough facilities, there's not enough psychiatrists, and the places that are available are doing no credit. I will say that I recently just scheduled an appointment, and I had to wait almost 2 months for that appointment to speak with someone to let them know, the doctors, to let them know that my child wasn't telling them the truth. I had to become a patient
in order for them to understand that what was happening was they were being fooled. So the mental health illness is serious. We're at a point now where my husband and I are getting older, although he is much older. You know, what happens to her? What happens to this beautiful college-educated person who cannot function in society? This is an illness that struck her in her late 20s, where she should have had the world to live. And now her life is in our house, thinking the military is after her, good days and bad days, you know? What do we do? The people that we have currently out there are not providing a service. And she's being medicated. She is under counseling, but they're giving her the wrong medication. And that's why I had to go there and say to them, listen, what are you doing? Not every person who has a mental illness needs to be on, you know, psychotropic drugs. But it's, and not only that, but now the pharmacies are telling everyone, we can't provide you with the medication because there is none. The last 2 months, her therapist isn't even able to give it to her because it's not available.
Thank you for sharing your story. Thank you. Is there any other speakers? Okay, at this time, I'm going to close open to the public. We have a meeting at 1 p.m. here in 4 minutes, 5 minutes. Board of County Commissioners regular meeting. I appreciate all of you coming, and the workshop is very informative, and I appreciated each speaker, deputy, and the stories, but I thank the mothers that came to share their stories. It's very touching. Thank you. We will adjourn until 1 o'clock.